9:35, but welcome to the Minnesota Board of Animal Health. We are here today in Sawatzke at Farm of America. And I want everybody to know that we are here with celebrities today. Peach and Blossom reside here, and they're very famous turkeys. They are the two turkeys that were pardoned this last year out in Washington, D.C. at the presidential Thanksgiving turkey party. So make sure that you go find them. All right, I will start with introductions. I'm Erica Sawatzke, a chief producer, so I have to give that shout out. President on the board. Sure.
Dr. Peggy Ann Hawkins, a swine veterinarian, on the Board of Animal Health from Northfield, Minnesota.
Alex Stady, beef producer, Dr. Schaefbauer, superintendent.
Brian Hoefs, state veterinarian for Minnesota, executive director for the Minnesota Board of Animal Health.
Medina, director of relations, the Board of Animal Health, and the Department of Agriculture.
Melissa Smith, business manager for the board.
Steve is a veterinarian, senior veterinarian for the companion programs board.
Stacy Holzbauer, state public health veterinarian at the Minnesota Department of Health.
Dan County communication specialist.
I'm Erin Prater, I'm the other communication specialist at the board.
Eric Shaw, assistant director of the board.
Shauna Voss, Minnesota Board of Animal Health Poultry Programs.
Michael Kusan, communications director.
Stephan Schaefbauer, area veterinary in charge of USDA Hoefs.
Maya Locker, compliance with the board.
Patty Evans, Ingle K, Farm Survey Program, Board of Animal Health.
Heather DeMico, senior veterinarian for the Board of Animal Health, Farm Survey, Horse and Shooting Programs.
Ashley Colson, Central Growers Association.
Steve Neal, beef cow producer, a member of the board, Northfield.
Brandon Schaefer, beef and pork producer, member of the board.
Brenda Hardcock, Minnesota Producers Association. Mary Williams, I'm a veterinarian, just good now.
John King, I'm district veterinarian for the Board of Animal Health.
Kate Drury, I'm on fourth year governor.
Paul Anderson, chairman of the Anthony Small Welfare Committee.
Do we have Dr. Fox on call? Maybe not. Dr. Fox will be here. She's running late, so we'll maybe have her introduce herself when she arrives, but we'll move on to the Dr. Abby, can you introduce yourself as you?
Okay, Dr. I'm Dr. Abigail, here in Wisconsin, and we'll have your in Minneapolis.
Great. Moving on the agenda, do we have a motion to approve the minutes from April, our quarterly meeting things? Is there a second? Second. Been motioned and seconded to approve our April meeting minutes. Is there any discussion? Any discussion? All in favor, say aye.
Aye.
Opposed, same sign. Meeting carries. Motion carries. Is there a motion to approve the agenda for today?
So moved.
Is there a second? There's been a motion and a second to approve the agenda for today. Any discussion? Any discussion? All in favor, say aye.
Aye.
Opposed, same sign. Motion carries. Brian.
She was on last night. Got camps. Yeah, it's cool that she should.
All right. Updates. I looked at my slides and I already missed a slide. So I'm going to start with that. It's been odd. It's been kind of a quiet summer, but a busy summer nonetheless. We'll chat a little bit about IPAC and H5N1 shortly, but really kind of non-existent in Minnesota, at least. Across the country, it's been fairly quiet till the last week. So we'll get into that a little bit. But the slide I forgot to include was my swine slide. So a couple of things that have occurred this summer in the swine program. There was a tri-national accord for African swine fever preparedness. So this was a meeting with our counterparts in Mexico and Canada, and actually Samoa was represented as well. Actually Michelle, Lucy, and myself went to Baltimore to attend this 2-day session. A lot of state vets, a lot of departments of agriculture represented, and industry represented. Some USDA was there, but kind of just rallying the troops, trying to figure out where everyone's at with African swine fever. I would say the takeaway is we're very well prepared, comparatively. Don't get excited. That doesn't mean we're completely prepared, but it did feel comforting to know some of the steps that we've made. Other states and certainly countries haven't gone to that length yet. So relatively speaking, we are sitting pretty good. Communications plans was a big discussion. I was proud to say our communications team has plans in place, templates for issuing those kinds of statements out when and if there's an outbreak. Probably the overwhelming theme that was echoed amongst the state veterinarians, though, was changing of the guards at the USDA level. So some of the questions were kind of eerie in some regards. Just questions about who's communicating with who, and it was really a realization for a lot of us about the number of people that have left the USDA on the buyout and people at the level that were kind of instructing on those sorts of things. So one of the key points that kept coming up is how are you going to communicate with neighboring countries if you get an outbreak? And up until this point, we don't talk to neighboring countries. That's a federal kind of duty. The federal partners work with anyone who might have influence over trade deals. So, but it appears that is a change. So nothing officially stated, but we did make sure to exchange some contact information with our Canadian counterparts, so we can start having some conversations, maybe even some exercises. I think it's a good thing to keep them up to date on where we're at and also up to date on what they're doing. So a good conference. It was great to get out and meet a bunch of those folks from other countries as well as our other states that we don't get to see them of. Other update for swine. We had our U.S. SHIP House of Delegates meeting last week. So Brandon, Eric, and I were in attendance to that. It was the first year that the USDA is really kind of taking over the U.S. SHIP program. So the intention is for that to be a codified program with USDA, similar to NPIP. So the shifting of authority was occurring to some extent in that meeting, which was good to see. A lot of representation from Minnesota with regards to resolutions and standards. So we had several resolutions that were submitted. The theme of those resolutions, I would say, is expanding the program to include other diseases. So the framework has always been African swine fever, classical swine fever, and I think a lot of us are feeling a little fatigue about African swine fever. Prepare, and it's not something that's here. And it's been a little bit of a struggle to even get some continued participation in U.S. SHIP, just preparing for something that we don't have. So we put forth some resolutions to consider additional diseases, PED virus, mycoplasma. There was some discussion about pseudorabies and brucellosis in show pigs too. So some additional certifications, more similar to what NPIP does, where you can be an NPIP participant, not necessarily in all categories, but kind of pick and choose. So that's the theme, I guess, I felt coming away from that meeting. We also had a request to reinforce the General Conference Committee. So the GCC is kind of the administrative body of US SHIP, and it's made up of the industry. It's made up of the participants, those that are actively involved in the field. And to us, that was important to make sure that stays, to make sure we have that influence, that that kind of oversight of this program, and it doesn't completely go over to USDA oversight. So that also came out of some concerns about what was happening with the General Conference Committee for MPIP. There were some concerns that was going away. I believe that that was saved in the 11th hour, but just we wanted to make a point of getting that across to the USDA and the Secretary of Agriculture, that we feel it's important to continue having that representation. All right, on to my updates that I remember to include in the PowerPoint. So we'll start with IPATH and H5N1. I don't know who, someone told me I shouldn't say this out loud, but here we go. Minnesota declared itself free of IPATH on August 25th. Since then, our neighbors to the west have reported cases starting. So we recognize this is probably short-lived freedom, but we're kind of pleased with the events that led up to this. Our last case was February, and that was a backyard flock.
So last commercial.
Last commercial flock was in February. So as of the end of August, our last backyard flock was allowed to go through their fallow period, and since we had no more positive cases in poultry, we were able to declare ourselves free of that disease in poultry. But as I said, South Dakota and North Dakota have been reporting cases in the last week. So 4 and 2 for South Dakota and North Dakota respectively. This map also shows Georgia had a case as well. So these are the latest cases within the last week. And I'll tell you, this map is going to light up. I was in a meeting yesterday with some other state veterinarians, and there's more activity in other states. Arizona, Texas are starting to show some positive cases. I think North Dakota and South Dakota might have some additional positives as well. So interestingly, the birds that they're seeing are not the migratory waterfowl. So talking to Dr. Thompson and Dr. Hendricks from the Dakotas, they aren't seeing an influx of geese, swans, ducks. They're more concerned about the resident birds, maybe commingling somehow with those migratory birds, but it's not the migratory waterfowl yet. Preliminary serotypes, Dr. Thompson said they've gotten one back, and it's the D1.1. So this is the virus strain we had last year. It's not the strain we considered dairy strain, but it is the one that was circulating in Minnesota last year. So time will tell. We're still waiting to hear from our Canadian counterparts on activities up north, Alaska as well, if there's more detections up there, but nothing has been reported yet. So I gave you the yay, and then I'm bringing it. But wait, there's more. H5N1. So ironically, we were also able to elevate our status in Minnesota to category 4 for H5N1 in dairy cattle. So category 4 means that basically kind of the same thing as poultry. We can kind of declare ourselves free of this virus, free of detections anyway, in Minnesota for the last 4 months. So you'll recall we had one positive case, kind of a unique case earlier in the year, but it's been 4 months since we've had any suspect or positive cases since then. This map is just highlighting all the states that are doing the milk testing, and in the Midwest, I kind of wanted to show the 3 states that are at category 4. So Minnesota, South Dakota, and Iowa have reached that category 4 status. So this has been good to see. It seems like the H5N1 activity in cattle, that B313 strain has kind of died out. California still has a little bit of it circulating, but it doesn't seem like it's still circulating in our dairy cattle. However, we do have some spillover activity with the other strains that were recognized in Arizona, and then Texas just reported a case last week as well. So it's sounding like those are maybe individual introductions, so not the widespread cow-to-cow introductions that we were seeing with the B313, but kind of early. We don't know exactly how that one is going to spread, how widely it's going to spread in cattle. So again, yay, we're category 4, but hang on, we don't know what's gonna happen when migration starts and when cattle are more exposed to this virus in larger doses, so. That is where, I did want to update on, so where we're at with the milk testing. So we partnered with Department of Agriculture on our milk testing strategy in Minnesota. It worked conveniently because they already had milk testing going on with all of the dairies. Basically 100% of our dairy cattle are being tested when they are shipping their milk. No extra work for the farmers. It's something that just comes from the labs that are doing routine milk testing. We have discussed with the USDA how we can reduce that. If we get to category 4, do we continue at this level? Can we reduce the amount to just kind of take some strain off our labs? And it was determined that we can go to, and Dr. Neeser from Department of Agriculture came up with this idea that we go to every other month testing. So continue testing 100% of the dairy herds, but instead of testing them once a month, they'll be getting tested about every other month. Caveat on that is we are waiting until October to start that. We want to see what the migration period does, if that's going to bring some virus that actually changes things, and we need to resume the every month testing or more. We kind of just want to wait and see what migratory will all add to the equation. Federal movement order and the response actions are still all the same. There's requirements for testing lactating dairy cattle, and they're going to be moving interstate. New World screwworm has really been kind of the big topic this summer for state vets, departments of agriculture, animal industries. This is kind of the big one. We talked about this this spring, the introduction of New World screwworm into Mexico that was bringing some alarm. And since then, we've got some additional information that's brought a little closer to home too. But I just wanted to throw some pictures up there and give you an idea of what we're talking about. So that's the fly, that's the maggot, and that's the result. So this is a picture of a key deer. So back in 2016, 2017, I think Florida had an outbreak of New World screwworm in their wild deer population. But just to give you an idea of what this is doing. So the deer are prone to antler infections, and these flies like to find an open wound and just eat living tissue. So literally this deer's head and brain were eaten from the inside out. So that's the concern, getting into our livestock, getting into any more blood damage. I just want to point out the fly. So I've been doing a few interviews on this, and we've been getting a lot of media attention locally and nationally. We've been trying to get as much information out as possible, and it's worked because I'm getting a lot of calls. We're all getting a lot of calls about these red-eyed flies people are seeing. So my point with that is we're probably not detecting this on the fly, we're detecting it on the maggot. There's a lot of flies that look like that, but it's really finding those maggots burrowed into an open wound that are of concern to us. So nothing is in the United States yet. The closest detection is still about 370 miles south of Texas. So that's closer than we'd like, but it's still at that point. And I think the last detection was midsummer. I want to say it was June or July. I'm looking at you, Stephan. Do you remember if it was June or July
Or
for the screwworm?
Veracruz,
Yeah.
I think that was July.
So no further northward movement since then that's been reported. Now, the map kind of shows you how that could be a little problematic. That's a big spread of land that potentially hasn't had a lot of surveillance, especially in wildlife. So that's one of our concerns. We certainly are worried about it in our domestic species, but the wildlife sector is a big problem if we can't control it from getting into those populations. Some things that are still occurring, USDA is developing sterile fly production and distribution facilities, both in the US and also helping out in Mexico and South America. So I talked about this in the spring. I think too, we're working on getting some facilities to produce more of the sterile male flies. Just a reminder, these flies reproduce in a way the females only breed once. So sterile mating with male fly is basically end of the line. We don't have more flies being born from that mating. So that's kind of the strategy that has been used historically. In addition to that, we're working on some other options. So this has been something that Secretary Rollins has kind of hung her hat on, that it's not just going to be sterile flies that help us get out of this. We have to have some other parameters, some ways of preventing the infection. So there's certainly some pharmaceuticals out there that we can utilize to prevent parasites from happening. The last bullet point is the one that kind of has brought the attention to light recently. So this would have been earlier in August. There was a human patient that had a detection of New World screwworm in Maryland. So the history was she had traveled to it was El Salvador, yeah, and the wrong country. So anyway, she had been traveling. That's where she had contracted these flies. It was taken care of. The patient is doing well, and everything was resolved. But the point of that, I think the key point is this is what we've been kind of concerned about in the northern climate is now that cattle or wildlife are going to introduce this into Minnesota, but travelers with pets are potentially going to be bringing this northward. So unfortunate situation, but I think it also helped to highlight those concerns that I don't think initially were recognized at a national level. So some preparations that are going at the state level or in the US. So the FDA has been fast tracking some approvals for off-label use of medication. So as veterinarians, we can prescribe, we can administer medications different from what it's actually labeled to be used for. That's part of our license. But there's some approvals that are getting streamlined to actually allow some of these drugs that we know are effective against New World screwworm to actually be used for New World screwworm. So be labeled for that purpose. Another activity that's going on, the NASA Hope Group, so that's the National Assembly of State Animal Health Officials, is working on developing guidelines of what we would do in the US if we get a detection in one of our states. How are we going to control it? How are we going to maintain commerce within the US as well as outside? But some of the plans that are in place specifically around movement requirements. So requiring a certificate of veterinary inspection within 7 days of movement, inspecting all free and open, or inspecting animals to be free of open wounds. Animals moving from an infested zone must be treated at least every 2 hours. Just some suggestions that are coming from this working group to prevent this from spreading within the US. And then also kind of determining what our surveillance zones will look like. So a different situation from IMAC. These are parasites and not viruses. The way they spread is different. So determining how we control a surveillance zone, again, how it looks similar or different from our typical response. Learn more about screwworm than I ever thought I'd know. That really has replaced the national discussion for IPAS. The meetings that we used to have for IPAS were overcome by meetings with New World screwworm, rightfully so. Companion animal programs, just wanted to give some updates. Steve and crew have been giving some webinar series. So about every other month, you've been presenting on different topics. Some of the things you worked on, biosecurity, heartworm, and inspections. Those were three of the topics that came to mind. But just to let you know that those series are also on YouTube. Dan's got those set up, so they were recorded and can be reviewed. Well, I heard good things. A lot of people were happy to have those and be able to jump on. Did you count how many participants you had on, or was it?
I would average somewhere in the 20s, right? That's in the meeting. Yeah.
So, and more of those to come. We've got more of those planning about every other month still. So, Tularemia has still been haunting us. We are up to 21 cases in cats and 2 cases in dogs. Working with our partners at Department of Health and DNR to try to get some awareness out about that particular disease and how to prevent exposure to it. Rabies cases, we've had about 32 positive cases. This is from, Betsy, I hope I got your notes right. 25 investigations resulted from those positive cases, and 93 total investigations that our staff would have done as a result of its filter. So rabies has been rearing its ugly head again, and often. The last one there, brucellosis. We unfortunately had another case of canine brucellosis detected last week. I believe it was early last week or the week before. So a similar scenario that we've had before. This was a case rescue group that had taken some dogs from reservation out in the Dakotas, adopted them out, a litter of puppies, adopted them out. One of the dogs was showing signs of back soreness, back pain, was detected or was determined to have brucellosis after visiting the veterinarian, and we're still trying to sort. Actually, you just told me that all 3 of the litter have been found. So that one was detected positive. A second one was positive, and the third one that you just found out was negative. So unfortunate, but we're working on maybe some policies to avoid this from happening again. So the unfortunate thing is it's coming from the same region. We know this region, we've had these cases before, and we're working with Steve, Andrew, and I are talking about how can we impose restrictions or awareness, I guess, at the very least, that this is a dangerous area to be bringing dogs from. There's got to be parameters in place for testing. This rescue group did test these dogs, and they tested negative, but the dogs were 8 weeks old, so a little bit too early to be testing. So trying to identify some better parameters so we don't have to go up to these owners and tell them either you're quarantined for life or you have to euthanize your family member. It's heart-wrenching. These dogs are usually with the owners for months, if not a year or more, before they find out. So difficult situation to be in, but we are especially on that case. I'll go to some good news. Let's move away from the brucellosis. So Dr. DeVito was able to secure some additional funding through cooperative agreements for our service producers, specifically genetic research funding. So a substantial amount of money. Congratulations to Heather for getting that done. I didn't give her much of a chance, and she pulled it up. So there's a lot of interest in genetics testing in other species. So we've done a lot, or there's a lot that's going on in white-tailed deer. But there's some funding and research specific to our elk farmers that is finally available to determine what kind of resistance may or may not be in those elk. So right now we have 18 producers that have signed up 925 animals to participate in this genetics research. So kudos to Dr. Sneeko. I'm sorry to give you more hope.
And thank you to the North American Elk Breeders Association for helping us organize
Yes, for
that.
spreading the word, yes. And now another downer. So we had a rash of West Nile virus cases. This unfortunately is a typical appearance of a horse that has West Nile virus. It's the devastating neurologic disease, very preventable neurologic disease. The vaccine is actually pretty good at preventing or at least diminishing the signs. But to date, we have 11 cases. We just had another one yesterday. It really kind of came in, those are all within the last 2 weeks, if I remember correctly.
Yeah,
It's
pretty fast.
It's been pretty hard hit. So, and widespread. This is at one location. It's across the state. So, so far 5 deaths have occurred from that. Ramifications. So it's frustrating because it's a very preventable disease. We have good vaccine for this. It doesn't 100% guarantee a horse won't get West Nile virus, but it certainly reduces the risk of it developing to this situation. They typically would recover if they were vaccinated. This also is an area we collaborate closely with our partners at Department of Health. So West Nile virus doesn't spread from horse to people, but horses don't exist without people taking care of them, and people being in the same area as the horses where these mosquitoes are that are carrying it is definitely a public health risk. So whenever we get one of these cases, we refer them to our partners at the Department of Health. Sometimes vice versa, we had the other happen too, where someone will call us from the Department of Health with a case. So point being, we need our partners to explain to people what their risks are, what kind of mitigation factors can help prevent them from getting the disease. There's no vaccine for people that I know of, but we certainly have ways of, eliminating stagnant water and insecticides to keep the mosquitoes at bay, and sometimes just staying inside when it's heavy mosquito time. Exhibitions have, for the most part, wrapped up. We've got a few stragglers yet as far as fairs are concerned. Pretty good season. Nothing major coming out of our county fairs. The occasional educational warning, some things that have to be fixed before next year. Just often as we see these county fairs are often run by volunteers and volunteers change. So sometimes getting that information across and making sure everyone is aware of how things were done in previous years. Dr. Corneal has done some seminars to help educate both the fair managers and the fair veterinarians. So we're going to be continuing to do more of that. I think that was effective. The Minnesota State Fair was another big success. I think I had mentioned that we had received some concerns about the Miracle Birth Center and aspects of that actually seem to be dealt with just fine. The Miracle Birth Center was well attended. We had actually had some visitors from Ohio that wanted to come see our Miracle Birth Center. They wanted to see if they could replicate it at some level at their Ohio State Fair. So it was fun to have them. Commissioner Peterson, Eric, and myself were able to take them on a tour of the Miracle Birth Center, as well as the other livestock barns and even some of the rest of the fairs. So did you all get a chance to, Alex, what are your kids?
Yeah, my daughter was Spring Pepper deal.
Yeah, Eric said, yeah. Congratulations.
Thank you.
I didn't get a chance to watch it, but it was exciting to see. So that, I believe, is that. Yeah. Any questions? Of course.
Can you introduce yourself?
Sorry, I can introduce myself. I'm Dr. Stephan Fox, board member from Southwest Minnesota, veterinarian. For the brucellosis testing, I don't know off the top of my head, how old do the dogs need to be since they're testing too early? What is the age?
Many first,
6 months would be the earliest that you really want to look at it.
Okay.
Yes, that's the problem.
Yeah.
Yeah.
For the new growth screwer, you mentioned FDA drug approval. Is the drug for, I'm sorry, I missed it, for cattle or for humans or for, like, what's the?
I was just talking about it's ivermectin.
Oh, it is,
Yeah,
oh,
it's-
sorry.
Ivermectin in classes of ivermectin. I'm not waiting for new world screw but at certain concentrations, very effective.
Got it, sorry, I missed that. And then with the genetic testing, if I missed this too, for the farm survey, is that just resistance to CWD or other things?
Yeah, CWD is the main focus of that. So similar to the research that's been done in white-tailed deer, just hasn't been done in other species.
Okay.
Genetics.
Last question, if I wanted to read to understand better, like the exhibition rules and that kind of stuff, just to know what that looks like, where does somebody find, like, is that webinar, like, recorded, and is there like a book that has it?
There's a book on our website, so we have access to book materials on our website. Katie, I forget if,
Yeah, under our main bar, under animal movement, there's exhibition and it has the manager and official veterinary requirements. It's also linked to printable on the right-hand side, PDF handbook. I'm trying to think, I think the recording of previous webinars, is available by emailing me for the link I can send out those presentations. Otherwise, they've all been like live in person at various, events. So, but yeah, reaching out to me or my program admin, Nancy Reed, we can, always help point people in that direction and are looking to try and find the dates for the district meetings. So we were going to one this year in the annual convention, but Yeah, if you hear more places we can go, happy to do that. Thank you. Yeah.
A question off of that, does the Board of Animal Health have a YouTube channel? Like, I know what I'm talking about. Could we get, obviously, the companion animal, part is utilizing that quite well. Could we do something with some of these other webinar things and open up and have, you know, like files of videos? One would be bears, and others would be small.
Yeah, absolutely. It's gonna be together. At the moment, we just have the board meetings, obviously, and then a few other miscellaneous videos and the companion animal webinar series. But there's certainly anything that we can afford, we can put on our YouTube channel.
And I'm not saying every webinar needs to be there. You might say, well, this webinar was good, but you know, it doesn't rise to the level of something everybody needs to see. I get that. Anyway, just a thought.
Yeah, we worked on that, Michael, we started working on kind of YouTube library, I feel like a couple years ago, but I'm just gonna blame my iPad, we got to get something, but it's a good idea to
To get a hold of something, you can get a link to go.
No, I agree, if we had a way to just bounce it from our website to a YouTube channel, yeah, that's a good idea. But
I have just a quick question on the new rules for is it a foreign animal disease? Is it categorized as that or no? It's, to me, it's a
parasite, so that's,
right, that's why I'm asking. It's a weird thing to wrap your brain, like it's important
yeah.
and it causes devastation, but it's a weird thing to think about because it's a pest.
Yeah, and it's hard to say it correctly too, because you always want to talk about infections, but it's an infestation. That's, I catch myself to make sure I'm presenting it correctly, but yeah, it's yes and no. I mean, it's reportable. It's a reportable pest, but it's not a disease per se.
You talked about the kind of international, meetings you had on the asset preparedness and talked a little bit about USDA's kind of backing away from the communication internationally. Is there an effort across states to kind of homogenize the approach? What does that look like? Is there something we as a state need to?
Yeah, and maybe not categorizing that fairly. So I don't want to make it sound like the USDA isn't there to help. I think it's new. People are in the positions previously held by someone that was more seasoned in the communication style and some of those policies. So some of it is just the new people in those roles are just getting up to speed and recognizing what the expectations are, and maybe we're changing our expectation as well. But that being said, at the state level, if we don't, I mean, it would be a nightmare to have 50 different states contacting our foreign partners. So there's an effort to at least regionalize. So we've certainly been talking with our neighboring states here in the Midwest. You know, how do we work together if we're going to do any kind of exercises? We want all of us to kind of be on the same page, and that's not maybe a bad thing because we're going to represent different aspects of the swine industry depending on where we're at. So the way we raise pigs here is very different from Arizona, where they're still chasing wild pigs with drones here. So, and then we're also talking about 2 different countries too. You know, we're probably not going to communicate a lot with Canada on outbreaks that we have. We'd be more concerned about what could be traveling across our northern border. We still have trade and commerce that we have to consider. So I don't think anyone is just rushing out to just take the bull by the horns and contact these countries without getting some kind of approval or buy-in from at least other states, but certainly USDA. So probably a better categorization is USDA is kind of sorting out where we're filling these gaps, who's filling in these gaps, and how to fill in those gaps. Thank you.
Any other questions for Brian?
All right. Thank you for the updates you presented to the board.
Yeah.
Yes.
Thank you.
If we have Laura, Molgaard,
We're having some connection issues with her.
Okay.
I'm not sure if she's able to get on yet. Do we?
Is it connection issues with just her specifically or?
I don't think so.
It's both, the Molgaard and Dr. Hart. Both of them are having, she sent me an email.
When I was trying to look, I had no sound until quite a bit in. I heard you talk about the minute and stuff, and then I lost sound again too.
Okay. While we work on that, can I move on to, Michelle?
Okay, hi everyone, I'm Medina, Associate Director of Government Relations for Department of Ag and the Board of Animal Health. So I have just a quick list of updates. There's not a ton to talk about since we're still in the time, we have the next session, all of that. So not a ton of updates, but time for questions if you have any. So again, next session, the 2026 budget session is going to be policy focused. We did our 2-year ag budget last session, so we're full policy focused. There's probably maybe also going to be supplemental budgets. Unknown how much it could be. Again, we're still in deficit into the tails of our budget, so we can see. It sounds like it's going to be more kind of a tightening budgets at the state level, also just in light of the federal cuts that we've seen. So I don't expect the board to be asking for funding. We did use an increase to our budget last session, so I think we're sitting okay at the moment. Again, next session is going to start Tuesday, February 17th. And it'll end Monday, May 18th. So I mentioned two last meetings that there's a couple special elections, so there's 3 still. So the special elections for President Portman, Senator Anderson's individual will be happening between September and November. So that'll be 3 seats that get filled. They're currently vacant. There could be others as well as other state or federal races that are coming. Some state legislators, also to go with some state legislators are deciding not to run next session. Or not, sorry, not to our next election, but I think we will see a little more, maybe a couple other mentioned discussion, or just depending on how some of these other elections and kind of local issues turn out. We'll just watch and see. Also, just hearing there will be a special session here called by the governor about gun safety, and so that's not new to us, but just recognizing that the governor can open special sessions, but the legislature has to close them. So usually before they enter special sessions, we'll have agreements over what will be, what's going to happen and all that, and kind of set dates of when they'll open and when they'll close and what will be discussed during that. So that could happen here in February. We'll just kind of wait and see on that. But really, this is just preparing for next session. Working with the board on any policies or anything you want to look at, updating or changing for the session. We do at the agency Department of Ag, we have a public portal is currently open so people can submit ideas they have on policy. I'll say that it's more Department of Ag focused, but it's kind of the board line between the boards, and we had a couple come through. For the board, one was to not allow decline, which is not our jurisdiction. That is the Board of Veterinary Medicine, so there were recommendations for that. So that's one that's came through and I've heard of. We're just kind of tracking that and seeing kind of where we go, but I think for the board, really, it's just going to be kind of status quo for us next session. If there's any policy we need updated, we'll get that. Not a ton from the legislative front at the moment. Any questions?
Any questions for Michelle? All right, thanks for your update.
Yep.
I think we have them on. Okay. Laura, can you hear us?
Yes, I can. Can you hear me? Can you hear me?
I can hear you, yeah. Can you hear us?
I can hear you. Okay, good. All right.
can
Sorry,
hear
I was
you.
just waiting for that confirmation. Thank you for helping me get on today. I don't know what was going on, but it was a little challenging. So I'm just pulling my remarks up, and I'm sorry, Erin, I didn't get to them to you before last night. So I'm not sure that the board members have had a chance to see them, but hopefully you can distribute them now that you have them. But by way of update, the veterinary students are back in class, and last spring we had another record number of applicants. So we're up to almost 2,000 applicants for our 105 seats. This was an 11% increase over last year, and it's great to have so many applicants. It's also a challenge in reviewing all the applicants, and also that we have to turn away so many qualified people. The curriculum revitalization continues to advance, and our faculty and staff are working hard on that. We hope to implement that by fall of 2027. The Spectrum of Care Clinic is a new initiative that I don't recall if we talked about it when we last met. We might have. We got a $5 million grant in February, and we've been working to renovate the first floor of the Pomeroy building to be a Spectrum of Care Clinic. And for those who are not familiar with Spectrum of Care, it's really about giving students hands-on experience more in the driver's seat than they're able to be in our veterinary medical center next door. And we have hired our new director, who started just a couple weeks ago. So I will have more updates about that when we next meet with some more specifics. And within our 2+2 program, they have hired a new program director and associate dean, Dr. Lisa Lunn, and she comes to this program with a lot of great experience, both within the Texas A&M 2+2 in Canyon and also from the Alaska Fairbanks 2+2. So that's wonderful. I have shared with you the challenges of the veterinary loan repayment program in the state. It's been renamed as a large animal loan forgiveness program, which is totally fine. But unfortunately, while it was saved, which is great, and I thank everyone for their support, it did get a haircut of $100,000. So I've talked to Chair Rarick about revisiting that in the coming session, and she's very supportive. Also on DVM education, impacts from government, there are national policies that are changing the way we are able to teach to our students. The U.S. Department of Education has asked the AVMA Council on Education, which is the accreditor for all North American veterinary schools, to put in new regulations around the use of technology in teaching. And so that means that our students are back in the classroom with less flexibility than they had before. Some students like that and are finding they're able to focus more, and some students, I would say more students, are letting us know how much they don't find that helpful, and that they preferred the more flexible approach we had, where active learning sessions and laboratories were always in person, but that they could do some of their lecture prep more flexibly rather than sitting shoulder to shoulder with classmates. It's just the way modern students are. I've talked to you a little bit about strategic planning at the University of Minnesota. The Maroon, Bold, and Gold strategic plan continues to move forward, and I think we will have details on that later this fall. If you happen to receive a survey, let's say you're an alum of the University of Minnesota and you receive a survey, please do go ahead and complete that. I want to make sure we're emphasizing the importance of investment in the St. Paul campus and in things related to One Health. So that's an opportunity. If you receive that survey, they are taking kind of a random sample of people who've been involved so far. So keep an eye out for that if you get it. I think the title of the survey, it came from the consultants who are helping with that, EAB, but it'll say something about strategic planning as well. The Veterinary Medical Center is doing very well. We were reaccredited this spring, and we have just hired our new Associate Dean for Clinical Affairs. That was announced this morning. That's Dr. Rosalind Chow. So if you know Dr. Chow, please congratulate her. She has been an emergency and critical care specialist at our clinic for a long time, and also has been the small animal medical director for the last several years. So a lot of great experience. We have a bumper crop of new faculty who are joining the college right now. We've had great luck in recruiting in surgery, ophthalmology, medical imaging, small animal internal medicine, spectrum of care, clinical pathology, and more pathologists, various kinds of pathologists, surgical pathology, avian pathology, comparative food animal pathology, a swine researcher, and theriogenology. So I'd be interested in people's thoughts of why recruiting is so successful after so many months and years of challenges, but I'll take it. You might have read in the newspaper, and I've shared with you in the past that the University of Minnesota had operating budget cuts within the last year. We call those reallocations within the university system, and our reallocation, all colleges' reallocations were 7%. So that, of course, is a big challenge for any college, but especially a college that runs as lean as ours. And then, of course, on the federal funding side, there have been real challenges with grants that have been suspended or paused, or RFAs that haven't gone out. About 18% of the CVM's revenue originates from federally sponsored projects, so this has a big impact on the college. But I'll end on a positive note that philanthropy has been very successful. In the last year, we had a goal of raising $12 million, and we surpassed that by raising more than $33 million. Now, I will put the caveat on that many of these are estate gifts, so they're not all realized now, or maybe even within my lifetime, we'll see. But we are really grateful for that philanthropic support of our donors, alumni, faculty, and staff to help us support such things as student scholarships. And that is it for my report. I'm happy to take any questions.
Any questions for Laura? All right, I don't see any. Thank you.
Thanks.
Good morning, Erin. Can I proceed? Can you all hear me?
Yes, we can hear you.
Okay, and can you see my slides?
Can you make them larger?
Yes, I have actually put them in the slideshow mode. Is it better?
There, yes, that's better. Yep, thank you.
All right. Thank you. Good morning, everyone. I'm sorry I wasn't able to join in earlier. We had some AV issues, but since the last time we met in April and until today, I will be happy to share some of our updates at the lab. I'm Hemant Naikare. I'm the VDL Lab Director, and this is the Q3 report for the Board of Animal Health. We have 2 lab locations in St. Paul and the other one in Wilmar. And between these 2 locations, we have about 110 employees, about a $17 million budget. We run about 1 million tests a year. So for any members or anyone in the audience that are not aware about the lab, I just wanted to give that background. And the updates that I have are, on multiple levels, but the biggest update is on our personnel side. So we've had 2 retirements this summer, fall. One of the retirements was of Dr. Stephanie Rosso. To those who are swine producers or swine veterinarians, Dr. Rosso is known to everyone for the last almost 3 decades. She built the molecular diagnostic section and the swine diagnostic services at the lab. She retired on July the 7th. And, we were very grateful to the service that she provided, and we hope to continue increasing our caseload and supporting our clientele. Along with Dr. Rosso, Dr. Connie Gebhardt. Dr. Connie Gebhardt is our bacteriology section head, and she has been a swine disease enteric expert. And so she also announced her retirement this August. So while we have had two departures, we are excited to announce some of our new additions. And as Dean Molgaard mentioned about, it's a great time, fascinating time to have all kinds of pathologists. So I will just mention about three of them. We have Dr. Talita Resendi. She started in May of 2025, and she's a food animal pathologist who has a DVM and master's in pathology from Brazil and a PhD at the University of Minnesota. So she is helping our swine clients primarily and other food animal clients. Recently, in this last month, we have hired Dr. Varvara Semenova. Dr. Semenova is our poultry pathologist, and she will fill the void for more than a year that we have had. She just started just last week, has a veterinary degree from University of California, UC Davis. She just finished her residency in pathology at the University of Florida. So we're very happy to have her here. Dr. Carlos Lopez, he did his pathology and DVM degrees in Spain, and he's certified by the European College of Veterinary Pathologists. He also joined at the same time, and he is primarily our food animal pathologist with support for the poultry side as well. And so between these three pathologists that I mentioned, we are very happy to be back to, from being at very lean to having a substantial staffing that will allow us to focus on innovation and serving our clients better. I wanted to thank everyone who has served on these committees and have been patient with us. A lot of folks on the Board of Animal Health and as well as on this board have been very supportive, and we greatly appreciate your support as we continue the recruitment of our faculty at the lab. I want to mention about our contribution towards workforce development. So at the Veterinary Diagnostic Lab, we are one of the few labs in the country that also offer residency programs. And so we have two new anatomic pathology residents, Dr. Jessica Santos and Dr. Joshua Hall, and they have just joined our program this fall. And it is highly difficult to recruit a pathologist. So we hope that, by contributing to this workforce development, we would be able to, in the future, retain and not have to wait for too long to fill these positions. Along at the same time, I'm happy to report that our laboratory has been approved to be a host lab for CDC and Association of Public Health Laboratories. So under that, we have just added two of our new fellows, Dr. Nancy Scott and Elisa Melendez, and these are fellows for up to 2 years. I mean, definitely for 1 year, but it can be renewed for another year. And so these folks will help us to get trained in our system, and they'll be working on special projects. For example, Dr. Scott will be working on next-gen sequencing for companion animals. And that is a service need that is unmet. And so that's just an example of what these fellows will be doing with us. Likewise, we are hosting a Fulbright scholar from Morocco, Dr. Fatima Zahra Labori. She's a ruminant veterinarian, and she's here with us for the next 6 months. So between these three fellows and three more that are joining us by November, we'll at least have half a dozen fellows that will be trained at the lab and will be also working on adding new tests and conducting some retrospective research. Kudos to two of our faculty members, one from the Veterinary Diagnostic Lab, Dr. Arno Wunschmann. If you're a wildlife, stakeholder or, a companion animal stakeholder, Dr. Arno is known to you. With Dr. Arno and Dr. Declan Schroeder from our VPM department, Veterinary Population Medicine Department, these two faculty members have been recipient of two of our Legislative Citizen Commission on Minnesota Resources grants. And these grants are focusing on two aspects. One is to monitor the health and disease status of the wildlife in Minnesota, along with looking at HiPath AI's impact on Minnesota's wildlife. So these are 2 to 3 year projects and close to $2 million of commitment from the LCCMR for these studies. So we are very happy to conduct this applied research work at our VDL. Recently, our laboratory was also able to get approved for the level 1 designation of the National Animal Health Lab Network, and that is a network of 66 labs currently. And between the Wilmer lab and our lab here in St. Paul, we are now certified by the American Association of Veterinary Lab Diagnosticians, which you can see to the right side. So that happens every 5 years. And then the NALAN status level 1, which is renewed every year. So this allows us to conduct a lot of regulatory testing and testing for import-export as well. So we are very proud of these certifications. This endorses quality and builds confidence in our stakeholders. Very quickly, a slide on our caseload metrics. Like this is in the last 2 months, which is since the start of this fiscal year, kind of shows how our different sections within the veterinary diagnostic lab. So we have about 7 to 8 sections that we serve since we are a full service laboratory, whether it is the MPTL lab in Wilmer or the other sections in St. Paul, like a diagnostic, serology, mastitis testing, bacteriology, histology, virology, and necropsy. Through these all 7, 8 sections in the first 2 months, we have conducted close to 150,000 tests, and that is pretty much average and on ballpark with what we did in the last 2 years. Compared to previous year, we have been 9% more busy with 9% increase in our caseload. So we are hoping that we can continue more testing and serve our stakeholders. While we are doing that, we are also facing some budgetary challenges, as Dee Molgaard mentioned earlier in her presentation. So we had to make up for some of the, to offset some of our expenses to do with inflation and the cost of doing business. So we had a strategic fee hike, which was implemented on August the 15th, and it was on select tests. And we were very careful to make sure that we do not, we are not super expensive, but we're trying to make sure that we are able to maintain our budget. Our budget is only 10% state supported, and maybe about 13% we get funding from through the university for our operations and maintenance. But we have to generate 2/3 of our operational budget, which is more than $10 million, to support our personnel at the laboratory. So although we are a state lab, we still have to think it from as a private lab, but at the same time serve all our stakeholders. So in these situations, it becomes important, unfortunately, for us to review our fee structure every year. And so we went up with 4% fee hike this year. One of the good news so far has been that we have been, with thanks to the support from U.S. Senators Klobuchar and Smith's office, they supported our application for funding from the U.S. Senate. And the U.S. Senate has approved $1 million for veterinary diagnostic lab, which will be very useful for us for our capacity building. It will be useful for our electronic lab management systems. At this point, in the Senate has approved it. It has fully passed in summer, and we are waiting on approval from the House. And then subsequently, a final bill has to be passed into a law, which probably should happen by fall. I want to give a shout out to our stakeholders, Ms. Erika Sawatzke on the poultry side, and Dr. Mark Wagner, swine veterinarian from Fairmont, for providing some very instrumental letters of support for us with this. So we are keeping our fingers crossed, and this $1 million in new funding, if it comes to the lab, it will be a blessing for us. I'm getting close to giving the updates. Just have 2 more slides. This is to show that we are working on new tests to serve our diverse clientele. So on the ruminant side, sheep, goat, and cattle, we have added some new PCRs this summer, PCRs that primarily are allowing for reproductive tract disease testing, like toxoplasmosis, Coxiella, which is Q fever, chlamydia, trichomonas fetus. These have been already offered, and we are working on additional tests as listed with chlamydia and bovine coronavirus. We have a niche in the Twin Cities. We have some biomedical research device companies, and we support those companies with some testing that their needs are. So we offered post-respiratory coronavirus testing and encephalomyocarditis virus testing very recently, and we are working on 2 other tests that will be offered later this fall. So these are our lifelines, and we hope to, we hear back from our stakeholders, and accordingly, we start developing new tests. And lastly, I want to mention about our stakeholder engagement activities. We're trying to make sure that the laboratory is well represented at our local and regional meetings. We were at the PEAT, which is the Poultry Expo, and the North Central Avian Diagnostic Conference this summer in Minnesota. We participated in the World Pork Expo, and we were at the AASV meeting. We also try to conduct meetings with the veterinarians in Minnesota on the swine side or on the poultry side. We have an upcoming meeting on this Friday with our stakeholders at Wilmer Lab to introduce our new diagnosticians. And, we have been participating in a bunch of other things and upcoming meetings at the AAVLD and then the MVMA in January 2026. Happy to report that our laboratory has had close to 8 to 10 abstracts accepted at the US Animal Health Conference. And so we will be sharing our findings from our diagnostic testing at these labs. And last but not the least, as we approach the flu season, we are making sure that we are prepared for it. Just to let everybody know that our labs between BTL in St. Paul and MPTL in Wilmer, we have the capacity to at least test 500 tests for HiPath AI on a daily basis while maintaining our other routine diagnostics. And if push comes, and if we have to focus only on AI, we could run up to 3,000 PCR tests in one day between the 2 labs. We have about 24 staff members that are proficiently trained to conduct these tests. And so between these 2 labs, I think we are well covered and prepared for our flu season. With that, thank you very much. That's my email ID if you would like to reach out to me, and I'll be happy to take any questions. Thank you.
Thank you. Are there any questions?
It's good to see, this is Dr. Peggy Hawkins, and it's good to see the pathology department so well staffed. It's been a long time. Thank you.
Yes, it's been a long time, and so we have 3.5 pathologists that have joined this fall, and we are also trying to diversify to make sure that we still are maintaining the specialty pathology group, but we're also trying to have our pathologists serve other species so that we are able to, fill the void and not be limited to just having, for instance, just one poultry pathologist or just one swine pathologist. So yes, thank you.
All right, thank you for your update today.
Thank you.
Stephan?
And I want to admit that I did not send my slide deck until this morning, and then it wouldn't go through. And so, public service announcement, send your slide deck to Erin when she requests it.
We're ahead of schedule, so got some flexibility.
the thought that makes me feel any better, I said my life thoughts. It's hard. Hard to do all the things. I apologize again.
I'm gonna blame it on that picture perfect Mediterranean bowl I made for my family. Sure they appreciate. Maybe I'll put it, you want to get it in there, you want to put it? And it's not that I'm short, it's just this podium is. Or maybe it's a little both. Board members, thank you again for inviting me, to do the USDA updates. I want to thank Chair Erica for, making requests on which updates to provide. I really appreciate that because I want to present on what you guys might be interested in. So we'll be going over a little bit about the poultry biosecurity assessments and how those are going nationally. I'll talk a little bit about the USDA reorganization. I'll try to touch on some points, hopefully to complement Dr. Hoefs' new rural screwworm update. And then I'll also present about USDA's new rural veterinary action plan that had just recently been released. And then I have a few other small updates as well. And I thought I'd switch the slot. I'm gonna go forward and then go backwards. Okay, so you all may remember, and I'm blanking on which month this was. I think it might have been February or March. USDA Secretary Rollins released a 5-pronged plan related to HPI, and it included $500 million for strengthening biosecurity in the poultry industry, $400 million in financial release to producers, and so that had increased the indemnity amounts for layers in particular, and then $100 million toward vaccine and research initiatives, known as the Grand Challenge. And so it's this idea to provide, more opportunities for vaccine research and therapeutics and different ways to approach HPAI in poultry. Along that plan also included regulatory burden reduction that was more related to some things with FDA, and then exploring temporary import strategies to stabilize supply and prices related to egg prices, trying to drop those. And so, the biggest part of that 5-pronged plan though was related to biosecurity, excuse me. They also ended up, when that biosecurity initiative came out, it was mainly focused on the most impacted layer states and layer facilities specifically. A month or so later, they expanded it to all poultry sectors. And it's where you have 2 voluntary programs, the wildlife assessments and the biosecurity assessments, where USDA covers up to 75% of the costs of producers doing those assessments, where they might have biosecurity gaps on their farms. And yeah, I mentioned that initially egg layers were prioritized, but really as those requests have come in, they've all been triaged and done. And so these were the 3 main types of biosecurity assessments. And so the first 2 are voluntary. So you have the wildlife biosecurity assessments. In Minnesota, we were one of the pilot states before this became a true program. So we had been helping out with doing these. And so those are more widely available. And then you have the biosecurity incentive focused assessments, where they review existing biosecurity plans with farms and they pinpoint those gaps As those gaps are pinpointed, producers can apply up to 75% to have those costs covered. And then we also have the mandatory audits, though, the BCAP, the Biosecurity Compliance Audit Program, that are required before restocking a previously HPI positive and moving into buffer zones. Dr. Voss has, been integral in Minnesota helping, because that came before the BFA. And so we have field staff that are trained to do those audits. And I feel like we were some of the first, she was some of the first to get those done. And those are still going on as well. So far, there have been a little over 1,200 biosecurity assessments completed nationwide, and almost a 50-50 split between those that are wildlife biosecurity assessments versus the domestic ones. I will say this total actually also includes the BCAPs, and so the mandatory audits. And so the numbers are a little bit can be confusing. And I only say that is because when you go to the map and you scroll over Minnesota, it's a lot more included than we've done for the voluntary program. And so that's why I have to mention that. And I thought I had a QR code for those dashboards. Oh, there it is, yeah. And so, but I can make sure to get a one-pager with the links or something to the board members so that you can, we've been developing a lot of different dashboards, and they're really useful for kind of keeping your finger on the pulse of things. All right, next up, I'll talk a little bit about the USDA organization. And so in July, Secretary Rollins announced some structural reforms. And the goal of those reforms were to streamline USDA, reduce costs, and strengthen the field presence. And so with that, there is this plan for a relocation of about 2,600 USDA staff. So that's across all of our mission areas, not just APHIS. From the Washington, D.C. area to 5 new regional hubs. And so those hubs are Fort Collins, Colorado, Indianapolis, Indiana, Salt Lake City, Utah, Kansas City, Missouri, and Raleigh, North Carolina. I will say for APHIS, we already have employees in Fort Collins and in Raleigh. Those are 2 of our APHIS hubs. And then they have they're estimating about 2,000 staff to remain in the Washington, D.C. area. That reorganization has 4 pillars. And I've kind of touched on this already, meant to align the workforce size with available resources, bring USDA closer to constituents, eliminate redundant bureaucracy, and consolidate overlapping support functions. This is the part where, I want to make sure that the board knows, that our stakeholders know, that USDA has opened a public comment period about the reorganization. And so stakeholders are invited to submit feedback on the regional hub placements, research continuity, and potential impacts on service delivery. And then that feedback will inform final implementation. Initially, I can't remember the initial date for the comment period, but it was a little short, and USDA recently extended the public comment period until September 30th. And so if anyone has trouble finding where that, I would just Google USDA reorganization comment period and the information, because now I'm realizing I didn't more specifically put in here how to submit those comments. Because it's a little bit different than our comment periods for rulemaking, where there's a site. So I can circle back and try to provide that. My next update is related, just a quick update on the National Animal Disease Preparedness and Response Program. Current priorities for that staff is executing our current NADPREP cooperative agreements, closing out completed projects, and then preparing to launch the FY 2026 funding opportunities. When we go to the dashboard, Minnesota, I think we're second to maybe Iowa in the number of projects that happen in state. And so whether that's with the board, partnering with the university, or the university having projects, or the department, I mean, we're just really an active state with these projects. And so it's always exciting for me, just to see that we're always leading the way. And so along those lines, I wanted to make sure to share with the board that NADPREP funding was increased from 18 million a year to 70 million over annual increases. And this would expand those opportunities. And so additional funding, greater impact, and then looking at Minnesota, we get to do projects that help help our industries here. And so related to emergency response. So I just thought that was some good news. There will be another listening session related to NADPREP for stakeholders to share ideas about funding, share ideas about support. I mean, getting a NADPREP grant with the Easy Fed grants and the claims and all those things, I mean, it takes a lot of kind of behind the scenes support, and sometimes stakeholders may need more support from us. And so these listening sessions will be an opportunity to share that feedback. All right, New World Screwworm. And so Dr. Hoefs talked about this part. These flies only feed on living tissue of warm-blooded animals. There's a current outbreak in Central America and Mexico, and USDA is preparing for a domestic response. One thing I wanted to mention that, I don't think it's any doubt in any of our minds the impact that screwworm would have on agriculture. There was a economic impact report published in January. The report primarily focused on Texas, but I think we can extrapolate that. If you see how it impacts Texas, we definitely will see how it would impact other states. And so here it compared 1976 to 2016, and then extrapolated that to 2024, adjusting only for inflation. Now, some of Texas cattle numbers are a little different in that they have less sheep and goats, but they have more cattle. But ultimately, it estimated that Texas would see 732 million per year in losses, and the Texas economy 1.8 billion. And so, this is why we're fighting this fight, right, for healthy animals, healthy economy, not only for Texas, but for all of our states. One thing I thought was interesting in that report, which there's a QR code here for that, is eradicate. So between 1990 and 2016, we saw benefits. So the eradication efforts yielded $796 million per year in producer benefits and $2.8 billion per year in general economy benefits. And so it's just, again, I don't think none of us, doubted those numbers and probably could have guessed that, but I thought it was really important to share. And so, the history of screwworm distribution and eradication. So if you look at this map, you'll see the steady progression to pushing screwworm down to the Darien Gap. That's that area between Panama and Colombia. It's a forested area. And so the U.S. have worked with Mexico really closely and Panama to continue that southern push of screwworm into South America and away from North America. And so they created this commission for the eradication and prevention of screwworm. It's a bilateral cooperative agreement between USDA and Panama, that was signed in 1994. And so it employs 570, Panamanian nationals. And that's where we had that production plant and have the production plant in Panama, since 2006. And so they maintain 29 outposts throughout Panama, and 6 movement control posts, and then dispersal centers, both at the Panama airport and an airport in Honduras. And so with that, and one thing I want to mention too, is the only facility that's creating these sterile flies is located in Panama. And so that touches on what Dr. Hoefs was saying, in that that need to expand the production and dispersal capacity. So there's a 3-pronged approach for interventions for eradication. First and foremost is the sterile insect technique. I mean, to me, that's the cornerstone of eradicating screwworm. But then we've seen this northern spread of screwworm due to illegal animal movement. And so you have to have regulatory controls that also help. You can't just release sterile flies and expect, to that to be the only approach. You also have to have animal movement control and enhanced quarantine practices. And then also field surveillance and stakeholder engagement. Dr. Hoefs talked about this too. The sterile male screwworms are released to mate with wild females. I will say one of the things that is inefficient is that when they sterilize screwworm flies, they can't sex the flies, so you release both male and females. And so that's something they're working on too, to try to be more efficient, to have more males released. And they're releasing about 1 million sterile insects per week. Dr. Hoefs mentioned this, that USDA announced that it will be funding renovation to a facility in Mexico, and then we're building a sterile insect dispersal facility in Texas. And so trying to expand the number of flies that we're able to produce and release. Related to the movement control, we've suspended live cattle, horse, and bison imports through the southern border as a way to protect our agriculture. And then dogs are eligible for import from Mexico, but they have to have a health certificate, because once again, warm-blooded animals, and this is also where our accredited veterinarians come into play, making sure that they understand the risk just as much as our food animal vets and our producers. And then there's a ton of outreach materials, and again, in the minutes, we'll make sure that there's some hot links to that. I will say that economic analysis that I mentioned it's 2 pages, quick read. I found it very informative, and I don't know, I would recommend, actually, I was gonna say before bed reading, but I enjoyed it, so it might not put you to sleep, so. All right, and we talked a little bit about that. The response policy, and I think we might have talked about this at it was published in June, so maybe we didn't talk to the board members about this. So USDA had published a green book in June of this year to focus on the historical part of screwworm, but also a general overview and a kind of overarching response strategy introduction. It's not as in-depth as, say, our red books. And so it's really useful. I mean, they're all useful, but this is nice because it gives you more of our general idea. And then our playbook is in development along with foreign animal disease guide for investigations. All right, we're getting closer to the end of my presentation. So Secretary Rollins just last month introduced our Rural Veterinary Action Plan. And it's because our rural areas are facing critical shortages of food animal veterinarians. And of course, they are the cornerstone of, you know, a safe, secure food supply. And so this Rural Veterinary Action Plan was launched. The key actions in the plan include expanding and streamlining loan repayment and grant programs. And so we have the Veterinary and Medical Loan Repayment Program for veterinarians in rural areas. And so this action plan would help streamline not only the process for vets to apply, it would also increase the loan amounts. And so that's good. And then the Veterinary Services Grant Program is a program that's used to help practitioners gain items they need for their practice. And so that's going to be expanded as well. This plan would also improve data gathering on workforce shortages. Right now, a shortage area is determined by the state veterinarian. And so this would take that, from my understanding, take that burden from them and make it more real time. And maybe also increase the number of veterinarians that are able to apply. There's also recruitment and retention incentives, including pay adjustments, tuition support, and bonuses. Under that one, there are things like the pay adjustments would be for veterinarians in FSIS and APHIS, including recruitment bonuses for hard to recruit areas like our ports, our veterinary export trade services, like the people who do the health certificates. Another thing is our Salty Wilson Scholarship Program. Starting in 2026, students will get $40,000 in tuition reimbursements. And so that's increased significantly. Part of the plan too would also help catalog federal resources to help veterinarians start and sustain practices. And then there's planned stakeholder engagement through listening sessions that will happen. And I kind of touched on this, but there's $15 million in new funding for loan repayment programs, and then those recruitment and retention incentives, all to, help ensure strong rural response capacity. Some additional updates. We have 4 positions that are vacant. When I last spoke to the board, and my numbers, I think we were down 1 VMO and 1 AHT, but we're down 3 VMOs now and 1 AHT because we lost 2 veterinarians to the deferred resignation program, the USDA buyout. And so this is the only picture I could find with both of them. And I could not find a picture of Dr. Berger by herself. So I had to, and so you all know Dr. Berger. She's in the back there with Dr. Job. Gosh, how long have Karina been here? Over 20 years for sure. And so that was a big, I get emotional even, you know, she was planning on retiring eventually, but she left a little bit sooner. So we were super sad. And then Dr. Amanda Doran, she's in the green, she's right here, Dr. Doran. And so, so yeah, that, I mean, that was one of the updates since we last met. And then, another update, and I think I had mentioned maybe, I don't know, it feels like, I mean, Erica said that, she's like, a lot has happened since the last board meeting. But I don't even remember if I had announced prior to the last board meeting that our office is relocating. And so that relocation has been completed. We moved from South St. Paul to 250 Marquette Avenue in Minneapolis, Minnesota. Our phone numbers and emails are the same. And so, yeah, we're on Nicollet Mall in this building that's called the Mark, in Minneapolis. And that is it. This is my reason for staying sane. I had this summer I went to Baltimore, had a chance to help organize our family reunion. This is a picture from our sneaker ball. We hosted about 175 family members. And so being on the committee for that, I was happy to be wearing sneakers. I don't want any comments about how short I am and how, I already know I'm gonna be the shortest in the family. That's my 12-year-old Seth. And then my 10-year-old Skylar, who thinks every opportunity is a fashion, you know, to be a fashion. Anyways, that's it. Thank you for any questions.
Glad to see you here.
Thank you. You too.
Thanks for sharing your consider. It's, I mean, we talk so much about board and what we do, but it is nice to see like we are outside of the board.
Yeah, thank you.
You'd mentioned about the congressional disease response allocation. Have any of those dollars been earmarked for particular disease response? And if not, are there efforts that we as a board should be considering at points of pain within our agency to we can draw attention to the necessary targets?
Yeah, so the NADPREP funding isn't commodity specific, it's just emergency response specific. And so, and Minnesota, our projects have, I mean, it's a range of projects in both swine, poultry, maybe even service, maybe, I don't know, it's been a broad. And so it's really based on what our needs are. It's just a matter of, deciding what projects you want to do. I'm trying to think, I mean, we have, one thing I can do is share a list of the projects that have occurred in Minnesota. I'm sure some folks can, my brain is blanking right now on some of the titles of the mini projects, but they're open. And so if they're, you know, within the industries, if they're pain points, then it's just a matter of connecting and figuring out who's going to write the, you know, grant, the grant proposal. And I'm happy to help with that as well.
And follow up to that, is that, I know it'd be in the last year, we talked about the overabundance of overtime within the agency to respond to high demand. And the consideration for the lobby to the legislature to allocate funds towards a disease, more of a disease response staff plan. Is that something that these dollars can be considered for?
No.
Do you have an idea of what the thought process was with moving the office out of St. Paul to Minneapolis, since it seems like Department A or like a lot of folks that were working would be in St. Paul versus Minneapolis, do you know?
I don't. Yeah, I will say historically, the office had been located closer to the board's office, just like you said. And and traditionally, that's how it's been across the country, is that field offices are located close to the partners that we work closely with and serve. And so,
Any other questions?
I've got one on the New World Screwworm. You talked about, Panama having the sterile flies and all the work that the United States is doing. Is Mexico doing much about this?
So Mexico, prior to eradicating New World Screwworm in Mexico, they partnered with the US as well. As far as though, whether they have, dispersal centers or sterile, I don't know. I haven't heard that they have. But I get the sense that they still do partner with the US. I just don't know the monetary amount that they may be contributing.
Thanks.
Any other questions? Okay, thank you for your update.
Thank you.
So I will confess, I also sent my slide that was 9:45.
That's an unfortunate trend for a lot of them.
Thank you for reading this one. Thank you so much to the board for allowing me to present some updates from the Minnesota Department of Health. To keep the New World Screwworm conversation going, I just wanted to talk a little bit about the travel associated human case, and then talk a bit about West Nile, and then just some things for your awareness and some outreach events that will be happening over the next couple months. So first, New World Screwworm. So on August 26th, CDC, USDA, and the Maryland Department of Health announced a confirmed travel associated case. This was a person who had traveled or had returned from travel from El Salvador, had multiple healthcare visits, but was diagnosed with New World Screwworm myitis via telehealth consult with the CDC. And so the risk to the public, to people and to animals was considered to be very low. And there was a coordinated federal and state response, and USDA initiated targeted surveillance around a 20-kilometer area where this person was looking for flies. So this case raised a lot of awareness and concern, and started some conversations that I would argue probably should have been happening earlier about the concerns of travel with people, but it is something that isn't necessarily new. We have had travel associated cases in the United States from endemic regions previously. The unique part about this case is this is the first documented human case from the current outbreak that is expanded through Mexico. So some of the previous infestations have been in 2014. There was an infested traveler who returned to Washington State after vacation in the Dominican Republic. And in 2023, there was a traveler who had returned to Arkansas from Argentina and Brazil who had a surgical wound that was infected. This person actually had a nasal carcinoma that was removed, and over 100 larvae were extracted from the surgical wounds. And then in 2024, there was actually a traveler who had returned to Florida after vacation in the Dominican Republic. And this was someone who was staying at a resort, had fallen asleep outside, and actually had an ear infection infestation. The risk factors for New World screwworm infestations in humans, the flies will lay their eggs and they only need a wound on a person that's the size of a mosquito or a tick bite. So very, very small wounds can result in infestation. But risk factors include open wounds, foul-smelling wounds, ulcerated wounds, bacterial infected wounds, hyperkeratosis, compromised immune systems, and essentially a decreased ability to protect yourself from bites or not wearing any sort of insect repellents, sleeping outdoors, working around infected livestock, or being elderly or incapacitated. And so the clinical manifestations from New World screwworm are pretty dramatic. As you can imagine, this is a parasite that is feeding on live tissue. So the symptoms essentially vary based on the site of infestation, but patients will describe pain, sensation, movement, a malodorous bodily discharge, and there's extensive tissue invasion and destruction. And so the larva can actually be seen in or around open sores, and there are secondary bacterial infections that can happen as well. There have been deaths associated with these infections, and they may occur due to either a secondary infection that's a result of the tissue destruction, or depending where the larvae have actually infested. And so, especially in deep structures of the head or ocular infestations can lead to death. And so, just a kind of overview. If we do have a human, a travel-associated case that is reported in Minnesota, the suspected cases should be identified by a physician, and they are required to be notified the Minnesota Department of Health of any suspected cases. We'll then work with CDC has their telehealth parasitic diagnostic team to do confirmation by looking visually at the larva. And then NPH would notify the Board of Animal Health as soon as we have any suspect cases. And our goal would be to ensure that all larvae are accounted for and properly disposed of. And then also interview the patient to find out where their most likely exposure was. And then all of that information will be shared with our state and federal partners. CDC will officially notify USDA, share those investigation results, and then plan next steps, including surveillance and communication plans. And so on the human side of things, there's also been a lot of outreach because of the concern for travel-associated cases. And so CDC has hosted clinician education webinars, and there is actually a webinar targeted towards frontline clinicians that are occurring at the end of September. There have been diagnostic aids and educational materials that have been distributed to 18 different national health organizations to help raise awareness among frontline clinicians, and also media outreach, which was driven as well by this travel-associated case. Here in Minnesota, we are reaching out to our ED clinicians and also to our travel clinic clinicians to make sure that they're aware of the potential, especially as we move into our winter time when we have lots of Minnesotans that are traveling to places that are warmer. And then moving on to West Nile. As Dr. Hoefs had mentioned, this is a banner year for West Nile, including in our human cases as well. We've had 40 confirmed cases in people so far, including 4 deaths. We've had 30 positive blood donors, and so these are people who are usually asymptomatic and don't realize that they're infected with West Nile. But West Nile is one of the diseases that is routinely screened for in blood donations. On a normal year, we see about 35 cases, but we have seen prior outbreaks in Minnesota in 2003, 7, 12, 2016, 18, and 2023. So it kind of seems to be a little cyclic every 3 to 4 year weekly outbreaks, but it really is weather dependent as well. We are actually now in the peak of where we're getting reports of West Nile cases in people. And it's estimated that about, we only receive about 10% of the actual infected cases in people. And so most people tend to have either mild illness or asymptomatic infections. And so we're getting the reports of the people who have neuroinvasive disease. So they're presented with encephalitis signs or other neurologic signs. We're currently investigating 60 plus cases that are pending final medical record review and testing. And our deaths, we also have approximately 5 additional deaths that we're investigating as well that may be reported too. So this will be a record year for West Nile in Minnesota. And as Dr. Gates had mentioned, we're also seeing several non-human cases, reports in horses and birds as well. And so nationally, there have been 771 cases that have been reported to date, 64% with neuroinvasive disease. And the median number of cases that we see is around 2,000. But our neighbors to the west are also seeing increased numbers in cases as well. And so North Dakota, South Dakota, Colorado, and Arizona are also reporting high case counts. In our outbreak years, we typically see higher cases in the western United States. These are where the mosquito vectors that are most efficient at transmitting West Nile tend to exist. And as I mentioned earlier, most of the case reports of onset happen in August and September. So we're continuing to get those reports, and we'll expect our numbers and the national numbers to continue to climb as well. And then just to round out our update on just awareness and outreach events, as Dr. Gates had mentioned, it's also been a record year of tularemia cases. We have set a record for human cases this year. We've had 10 that have been reported as well. And we are also in the middle of the peak of human tularemia cases as well. Usually our numbers tend to start to decline in October, November. So we expect more human cases to be reported. But we've seen a record number of pulmonary cases this year. And so that's the most severe manifestation that we see with tularemia in people. The vast majority of our cases tend to be skin infections, but pulmonary cases are usually what put people into the hospital. And then moving on to some outreach events. We are currently working with our partners at CDC to do a backyard flock survey, trying to assess the knowledge of backyard flock owners for H5N1 in birds and people. So it's focused on H5N1 and HIPATH, but we're hoping to use some of this information to better understand Minnesota's backyard flock owner population, to also assist with outreach messages related to salmonella infections as well. We see outbreaks of salmonella with people who have backyard poultry every year too. And so we're collecting just some information on levels of concern regarding H5N1 attitudes towards reporting sick and dead birds, and also attitudes towards biosecurity and usage. And so many thanks to Dr. Voss for sharing this survey with poultry testers. We'll be sending out this survey also through the University of Minnesota's extension newsletter, as well as some social media posts. So please encourage anyone who has backyard chickens. I'm forcing my sister to take the survey, so we appreciate any information. Okay. And then in September, it's also Fungal Disease Awareness Week. So we'll be putting out messages related to blastomycosis and histoplasmosis infections and risk factors. We actually had our first horse, that was, positive, for Glasgow this year, and first time we've seen that in about a decade or so. And then World Rabies Day is on the so for 28th. So we'll be, working on getting some messages, out on that as well. And then I wanted to also let you know, that the National Academies of Science, is doing a PPE workshop, focusing on high-risk farm settings, at the end of September. And we've been asked to share our experience with human health monitoring in Minnesota related to H5N1. And it's bringing together people across the country, researchers, government officials, industry as well, to just kind of talk about the state of PPE usage, the barriers to it, and the need for developing agricultural specific personal protective equipment. So if you, these discussions will be recorded, and so also available for people to see after the meeting is over. And so with that, I'm happy to take your question. Questions? Thank you for your update. Oh, sorry, one quick update. Just this morning, we were able to confirm the date for our 10th annual emergent issues gathering. So you all should have received an email. If not, please let me know. But it will be December 10th. And many thanks to the College of Veterinary Medicine for helping us sponsor this gathering. But it will be at the U of M Kaufman Memorial Union on December 10th. So put it on your calendar.
Is it the 10th or the 9th?
The dinner's looking to that. The email says the 9th? Okay, well, listen to the email. 10th. Okay, there we go. All right.
But at least you know we got it. That was the quiz.
Yes, the 10th annual meeting. All right. I just lost yours. Thank you. Ready?
All right, well, we do have lunch after this, so I really hope these numbers and this quick update doesn't put you all to sleep. But here we go. All right, so I kind of have the slide set up the timeline here. So at our last meeting, we were going through what I call the dark times, right? We were in a budget freeze. There was a lot of uncertainty of federal funding and what that would look like. We actually in March canceled our disease testing contract. And we were still kind of facing those higher expenditures of raising salary expense, minute costs, and the disease testing rates in the future. Fortunately, we were able to, in early April, resume services and funding for these testing. So there's the positive. So over the summer and fall, we were able to secure our general appropriation through legislative session. So fiscal year 25 ended June 30th, which was the end of that biennium. A new biennium started July 1st, which is fiscal year 26. So chapter 34, House File number 2446, appropriated the board and funded the board for 26, 27. As you can see there, the numbers were 6,675,000 for 2026, 6,800,000 for 2027. So 265,000 for 2026 and 390,000 in 2027 to maintain the current level of service delivery. So that's our operating adjustment. Last fall, we had submitted a change item for the operating adjustment. We were granted the operating adjustment. It wasn't into the full amount that we had requested, but we did see an increase, so. All right, so what does that general appropriation look like for fiscal year 26 and kind of how it breaks out? So as you can see, 73% of our general appropriation goes to salary and payroll. That is our highest expenditure, and we foresee that being that way for the foreseeable future. Professional technical services, so that's gonna be our disease, contracts for testing. So with the U of M, University of Wisconsin, and some other smaller, contracts that we have. So that is about 9%. Information technology, so it's always on my list of higher expenditure is, our minute costs. So information technology costs for services, software, project management, is a continual increase that we see there. It's about 11% of our budget. 3% is space rental, maintenance, and utilities for our board space in the Freeman building. And then other space rentals that we have for board meetings for our annual or biannual conference trainings. Travel and fleet, we'll see that at 2%. That's going to include travel to and from board meetings, any other conferences that our staff go to. That also includes all of our field staff, their vehicles, their gas cards, all of that. Luckily, that is a pretty stable expenditure that is fairly easy to track there. And then we have our other expenditures, which is in that 2% mark. That's going to include, all of our phones and all of the additional expenditures that the board sees there. So pretty small margin there. And then the total budget. So we just got done talking about the general appropriation, but then we add in our budget of our cooperative agreements from USDA. And then our restricted special revenue, you'll see that I put 2 asterisks on both of those, because although we have a budget of 1.5 million with those USDA cooperative agreements, doesn't necessarily mean that we'll spend that or have qualifying expenditures that can be used. So, although we will have that available budget, doesn't mean that we'll actually spend it. And then the restricted special revenue is a very tiny sliver that we use typically in the last quarter of a fiscal year, kind of when all of our kennel and breeder fees are in. So that's where we'll see that number. That is our estimate. I believe in fiscal year 25, we expended 74,000. With the reduction of white-tailed deers, we have seen our revenues kind of decline a little bit. And also some of the funds that weren't expended in years prior, they do roll over, so into next year. So I believe it was 74,000 in fiscal year 25. I expect, because we expended that much, that not as much would roll over into this year. So we'll look to expend that special revenue in the fourth quarter, so spring of 2026. So looking at that again, we're working with an available budget of 8.3 million. That doesn't mean that we're going to expend 8.3 million. All right, so the board has 7 cooperative agreements currently. So we have umbrella and traceability, which are 2 cooperative agreements that we typically and historically have been funded. US Ship in the last few years, since USDA has sort of taken on that program, has generously given us a cooperative agreement. And then we have 2 emergency response cooperative agreements, so one for HPAI in response to poultry, and then H5N1 in livestock. Since being declared free at this time, our cooperative agreement for poultry is ending in October, late October. You cannot apply for another cooperative agreement when you are free of that disease. So in the event that we would have another outbreak or active situation, we would have the opportunity to apply. But until then, we'll just keep our fingers crossed and maybe not having to do that. The H5N1 in livestock, we did get an extension on that, so it was supposed to end, I believe, September, maybe October, I don't have that exact date, but we did apply for the extension, so those funds are available to us for another year. We have not expended or had any qualifying expenditures to use that funding at this point, but the funding is there in the event that we would need it. And then, like mentioned by Dr. Hoefs earlier, we do have 2 cooperative agreements for CWD and research. One, I should say both of them are for research. One of them is mainly indemnity, right? So we have that funding available in the event of needing that for indemnity. And then that new cooperative agreement that Dr. D'Amico worked very hard to get is more towards the research side of things. All right, kind of doing a comparison. I color coded some of this to focus on some of the numbers and kind of where my budget and accounting mind goes to. So looking at that salary budget, if you look at fiscal year 24 to 25 to 26, it is constantly going up. We also had in fiscal year 25 retro pay to pay for on-call that had not been processed in previous years. Fiscal year 26, we did just pay out on-call retro pay from fiscal year 24. So those are also another drivers that are pushing that salary expense up a little bit. New labor agreements and negotiations are ongoing. So 2 of the larger unions for the state, AFSCME and MAPE, just ratified their labor contracts for the next 2 years. With a lot smaller cost of living adjustments. So I know Brian and myself have talked about it in the past about having very high cost of living adjustments in fiscal year 23 and 24, 24, 25. But it was 4.5% and then 5.5% or the other way. But this year, they're looking at a cost of living adjustment of 1.5 and 1.75. So typically our standard is to budget for 2.5% in a cost of living adjustment, so significantly smaller. However, our agency will most likely absorb that cost fairly quickly with the new Minnesota paid leave law that went into effect. That will start January 1st, 2026. So our agency as an employer will start paying Department of Deed for the agency deed for that cost. So some of those the red numbers in fiscal year 26, those numbers, as you can see, compared to fiscal year 24 and 25 are a lot larger. And that's due to having cooperative agreement budget funds. So it's available, it's in the budget, but doesn't necessarily mean we're going to expend it. So when you're looking at travel and professional technical services and some of our other expenditures, we expect it to be a little bit higher than fiscal year 25 as you see there. But we do have available budget for some of those items as long as they fall in line with cooperative agreement funds or objectives, I should say. And then some of those green areas there. So IT, as you can see in fiscal year 24 and then to 25, there is quite a decrease in expenditures. Jean, our accounting officer, has done a wonderful job of really doing a deep dive in all of our invoices and all the different areas that we are charged by minute. And really, I don't wanna say cutting out waste, but definitely, streamlining what is necessary and what is not necessary. Minute did let us know, and I think I mentioned this at the last meeting, that they were expecting an increase of software costs and services at roughly 5.5%. So there is a budget there of 708,000. We are not expecting to expend that much, but we're prepared in the budget that it could potentially be up there. And then space rental, the Freeman Building used to be the most expensive, real estate in the Capitol complex. We were paying quite the mighty dollar to have our space there. And Department of Admin, the owners of the building, actually were able to pay off their loan for Freeman Building and pay off Freeman Building. So that resulted in Freeman tenants getting, cheaper rent. So we were able to sign off on our 26-27 lease agreements with a dramatic cost for renting that space, and we'll continue to see that again in fiscal year 27. So it's nice to see some expense go down for once, because I feel like I'm always talking about everything going up all the time. And like I already mentioned, reducing expenditures in other ways that we can, reduce any expenditures in like our Verizon bill. I don't think people realize how much money that we were spending on phones and just other supplies that, really, when you start to add it up, it gets to be a lot. When it doesn't look like a lot on a month-to-month basis, but when you add it up annually, it just gets to be a lot. So we were able to really bring some of those other expenditures down. Looking at fiscal year 24, our other expenditures was at 172,000, down to fiscal year 25 to 124,000. So being able to have, what is that, 50,000 some dollars that we were able to save the agency, in light of knowing that our salary expenses are always going up is wonderful. So looking into spring of 2026, and summer really, we're always kind of continually monitoring and communicating with USDA. Stephan has been wonderful about letting us know, kind of where the federal situation is. And when she has an update, she lets Brian or myself know, what's going on. So at this point, we'll continue to monitor it. I have fingers crossed that additional funding or historical funding that the board has seen that would be implemented in the spring will continue to be that way. I assume Stephan would communicate otherwise. And then the three things that I continually talk about that we'll continue to look at is our salary expense, the minute costs, and then our contracts with the BBL and watching the rates and kind of where our funding is at. And then prepare for fiscal year 2029 biennium. It's, since being in this role at the board, coming on, I didn't really know what was needed to really push for, demonstrate, who to communicate with and who to talk to. And I found in the last two sessions, and really having Michelle as a counterpart to work with and mentor me has been wonderful. However, with the state looking and expecting a deficit, it's going to be quite the mission to try to continue to express the need for more funding, right? So with the expenditures continually going up, but the funding not matching the rate of that going up, eventually we're going to hit a wall, right? So this isn't working at the rate that we're getting to expending. So that would be something to really deep dive into for that biennium. And instead of reacting, being more proactive. And so that'll be my mission in the spring. We'll see how it goes. Sometimes we have to just take it moment by moment in the government industry. And that's what I have at this time. I didn't have a slide, but mention that our assistant director position that was made vacant in January this year, with the departure of Dr. Courtney Wheeler. Due to our budget needs, we kind of held off on filling that. But with the new biennium and more funding available with the new biennium, we decided to post that job posting. Just closed, I want to say September 4th. On Monday, we actually got our list of candidates and we'll start scheduling our interviews. So I will update after we kind of get through the interview scheduling. And then one thing that I was sort of disappointed that Dr. Hoefs and Dr. Schaefbauer didn't mention was they both got to partake in the celebrity milking contest. And I think it was to talk about it and be there, but I actually had taken a vacation day that day and we did a sort of a family reunion with my husband's side. And so I had plans to be at the state fair anyway that day. So when I found out Dr. Hoefs and Dr. Schaefbauer were going to be there, I actually got to videotape them milking the cattle. And I actually think Dr. Hoefs found out he had a relative that was actually a part of the celebrity milking contest. Was it the dairy business? Yeah. So that was exciting. One thing that my husband jokes about is that there was a few board employees there. I want to say 5 or 6 of us. And he said, I've never seen so many people excited and videotaping their boss milking a cow. An outsider, I just thought that was very entertaining. But otherwise, those are my updates. If you have any questions, I'm open to take them.
I'm wondering why you didn't include the video.
Right. I do have the video on the laptop, so I didn't share. Actually, both of Dr. Schaefbauer and.
They might have been fine.
Thank you for your update. Are there any questions for Melissa? All right. Erin, what's the scoop on lunch?
They've just been waiting for us to finish up, so they're here. I'm gonna go find them.
Perfect. So we will break for lunch and we'll return at 12:20.
Thank you, good afternoon. Thank you so much for having me here today to talk a little bit about some updates from DNR. If you have not met me yet or don't know me, I am Mary Wood. I am the new wildlife veterinarian with Minnesota DNR. So I just started my position back in March, still learning the ropes running the agency. Certainly moving forward, if there are things that the board would really like to hear, I kind of put together a few things that I thought might be interesting, but happy to tailor to what folks really want to hear from our agency. So I'm going to talk a little bit, just real quick, where we're at with CWD and free-ranging surveys, and then some research projects that we've had going on that might be of interest, and go from there. I'm happy to change that in the future. I'm not sure when the board last had an update on chronic wasting disease and our free-ranging surveys. We cannot have a talk about wildlife health without talking CWD. It is inevitable. So I just thought I would share a little bit of where we're at now. So the map on the left shows all of our CWD detections through our 2024 surveillance season. So we certainly are seeing a few more cases appearing. We had 3 new deer permit areas come up detected this past year. And then in southeast Minnesota, we're really seeing prevalence increasing in that area. So I've got 2 graphs here on the right that show the prevalence in those areas where we really seem to have hit an inflection point where prevalence is increasing really quickly, and we're above 5% in those areas, despite a lot of efforts to try and manage the disease. So that's going to spur a lot of conversations that we're going to be having moving forward and how we address CWD in the state. And then if you look at that area just south of the metro, we're seeing quite a few cases in there. Prevalence is over 1%, less than 5% in that area.
And then continuing to have just some of these additional cases that are appearing in northern Minnesota, western Minnesota, starting to see that footprint of chronic wasting disease, maybe expanding unfortunately a little bit more in the state. And that does play into a little bit of how we perceive the management of the disease. So folks who aren't familiar with our CWD response plan, we have three kind of categories. We have our initial CWD response, so that's areas where CWD is present at less than 1% prevalence. So more of those early incursions of disease, those areas that we're seeing in northern Minnesota, western Minnesota, where we're just starting to get our management in place, doing more monitoring, surveillance, trying to understand. And then we have the persistent CWD infection, so that's where prevalence is above 1%, but below 5%. So that's where we're at in that area just south of the metro. And again, by management, surveillance, all of those actions in place. And then, of course, we have endemic CWD, and that's where prevalence exceeds 5%. So unfortunately, that's where we're at in southeastern Minnesota. And certainly, as we have more and more CWD across the state, we're trying to figure out how do we best approach surveillance and management of the disease in a way that's sustainable, because the more we have, the more spread thin we get with our resources and staff time. So we're hoping to have some time in the upcoming year to really reevaluate where we're at with CWD in the state, how that's going to change how we approach management in the endemic area versus other areas, and really looking at how we move forward to make sure that we can continue doing good surveillance and monitoring of the disease. We can continue applying management for the disease, but we can do it in a way that's going to be sustainable and unfortunately digging in for the long haul. So those are going to be big discussions that we're going to be having hopefully within the year. For 2025, for our surveillance, we have 3 new management areas this year for 3 new detections. Those management areas are in yellow, and then our surveillance areas are in gray. So both the management areas and the surveillance areas, we will have mandatory testing over the firearms opener November 8th and 9th this year. After the opener, it's actually going to be voluntary testing in those areas. And then anywhere outside of those areas is voluntary testing as well. So hunters can still have their harvested animal tested either through a partner sampling program, through a mail-in kit, or they can make an appointment at one of our wildlife officers across the state. As we're looking at that expanded area for surveillance, again, it is that challenge. So it's going to take us about 300 people to staff our 53 check stations and 37 South sampling stations just for this year's surveillance. So it is a pretty big effort for us to try and make this happen. We still have carcass movement restrictions in place wherever the disease is known to exist in our wild deer, so we cannot move full intact carcasses. But quarters with leg bones intact, processed meat, hides, teeth, antlers, clean skull plates, those can be moved. And then a change that happened in the past year is that the head with neck and hide attached can be moved outside of the zone as long as it's going to a licensed taxidermist within 48 hours. We do have dumpster quartering stations present in all of those management zones, and hopefully help our hunters comply with those regulations and encourage good carcass management. And then we do have feeding and attractant bans in management areas and surrounding areas. Again, just another attempt to reduce that artificial congregation of deer that might facilitate disease transmission. But I don't know how many of these presentations you guys maybe have seen over the years. That footprint getting a lot bigger and covering a lot more of the state where we're having these restrictions in place, and lots of new counties this year where we have feeding and attractant bans. And that was all I was going to give on CWD in the interest of time. I was going to pop in to talk about research projects and then maybe questions at the end, if that's all right. Hopefully there'll be time for questions. I'll be here the whole day too. So I just want to talk about a few research projects that I thought might be of interest, some different things that DNR is doing. We started a wild turkey health pilot project just this past year over our spring turkey season. So we don't have a whole lot of information about, diseases circulating in our turkey populations, general background health of our turkey populations. And there are some southeastern states that are reporting population declines in their wild turkeys. We have recently had some cases of avian pox virus infections in turkeys that we found were actually co-infected with lymphoproliferative disease virus. And we were just really curious to see what is out there circulating in our turkeys. Our population right now is considered robust. We aren't necessarily seeing declines, but this is a good time to get some baseline health information so that we know where we stand right now. And there have been other states that have been doing this more turkey health work and more turkey disease work. And so we were curious to see how our turkey populations look compared to some other states. We focus on our turkey permit area 507. This is really a pilot project to see if we can figure out how to do this best. This is our largest turkey area, and it's an area that also has a really high overlap of turkey habitat with domestic turkey facilities. And our goal is really to look at apparent prevalence and spatial distribution of some selected pathogens using hunter-harvested turkeys. Dr. Shauna Voss was kind enough, I know, to talk with our team a little bit about disease considerations, concerns for domestic turkeys. So we could incorporate that, really looking at that interface with our project here. Our target sample size was just 300 wild turkeys to start out with a pilot, really partnering with our hunters. We also partnered with the National Wild Turkey Federation to help support the project. We asked our hunters to fill out a request form for a sampling kit if they were interested in participating. Those that filled out that request were sent a kit that provided all the instructions for them to collect samples. So we wanted them to provide the head with a few inches of neck attached, part of the leg bone, and then ship that back to us with a little bit of data about where their bird was harvested. And we have some very preliminary results. I don't have everything yet, but it was very successful. Our turkey hunters were awesome, and we got 320 kits, and then we had to cut them off because we didn't have enough funding to actually go bigger than that. So we were pretty happy with the response that we got. We got pretty good distribution around the turkey permit area. We only had one that was submitted that came from outside of the area. And our hunters were really happy to work with us to supply those. We worked with University of Minnesota, Veterinary Diagnostic Lab and Poultry Testing Lab to do some of the diagnostic work. And then we're also working with the Southeastern Wildlife Disease Study in Georgia to do the testing for lymphoproliferative disease virus and reticular endotheliosis virus. Preliminary results are in on HiPath AI, and actually Dr. Wunschman with BDL was kind enough to support some of the HiPath AI testing out of one of his grants. So that was really great. Luckily, we didn't detect any low-path or HiPath AI viruses in those turkeys. No detections of avian metapneumovirus. No detections of Mycoplasma gallisepticum, but we did see 12 out of 64 pools that tested positive for Mycoplasma synoviae, the PCR. That was an interesting finding, and actually similar to some of our colleagues out west, particularly in Colorado, have been doing some turkey work and testing, and they're also seeing Mycoplasma synoviae in their wild Mary's turkeys out west. I don't think we know what that really means yet. We have a lot of questions. Would that potentially impact health or survival or reproduction of our turkeys? But we're curious to see more information moving forward. We're still waiting on SCOTUS to provide the testing for lymphoproliferative disease virus, in particular endothelial. They have to pull out bone marrow, and they're testing those samples as they are able to and have the capacity. So hopefully we'll have those results in the next couple of months. We'll be able to provide you guys with another update in the future meeting with the whole package. Once we have all of that done, we're going to pull all it together, summarize that, and then take a look at whether we want to continue expanding this and look more statewide and do a deeper dive into our turkey health. It was really nice to know that we had such good cooperation with hunters to collect samples. But there are certainly challenges too in having testing with hunter harvested samples and birds that were collected and shipped and frozen and then sampled. Certainly, we probably lose a lot of sample quality within that process. So stay tuned. We'll share more as we get the rest of the results from this subject. And then just a few other things that are on the radar, to go into depth. We've been doing some work on contaminants in wildlife. So we've had multiple different projects going. So work on PFAS, per and polyfluoroalkyl substances. We've done that in partnership with Minnesota Department of Health, Minnesota Pollution Control Agency. Again, more pilot work, looking at how do we do this? How do we approach sampling? What are we seeing? And so we've done some work in white-tailed deer, looking at areas that are known to have high contamination with PFAS. Certainly are seeing PFAS in our white-tailed deer at levels that are pretty similar to Wisconsin and what the Wisconsin DNR has reported, where they've even issued some health and consumption advisories. And then when we looked at waterfowl, we looked at a more contaminated site, known contaminated site, and a reference site that isn't known to have a lot of PFAS contamination. And we are still finding PFAS in those waterfowl, but a lot more with those contaminated sites. So it is pretty interesting to see that that is out there in our wildlife. Certainly seems like there's a lot more contamination in those wildlife that may be surrounding those more heavily contaminated areas. Probably work that's worth diving into further. You know, this is pilot work, small sample sizes, gets us a feel for what's out there and a little bit of how to go about some of the process to do the sampling work with wildlife samples. There's also a lot of work going on neonicotinoid. We have our avian research teams are doing some work in greater prairie chickens. They're also doing some work in pheasants. I don't know a lot of details on those projects, but they're with questions. Related not just to exposure, but also trying to see, you know, especially from a wildlife agency, one of our biggest questions on these contaminants in wildlife. Yes, there is the consumption portion of it when it comes to human health, but we'd really like to know how this impacts our wildlife populations. How does this impact population health? And what does this mean in the long term for reproductive health, metabolic health, things along those lines. We've done a little bit of white-tailed deer work out of our program, and we did find pretty widespread exposure to neonicotinoids in the white-tailed deer across the whole state. And we're in the process right now of combining our data with North Dakota and trying to do a broader analysis of that data together and hopefully put together a manuscript. And I should mention our PFAS work in white-tailed deer was just published this year, so that's out. The waterfowl paper is in process at the moment. So that's a little bit of our contaminant work. Other projects coming up are the big fancy ungulate projects. We've got an elk research project that's going to be starting up this winter. This is more of a management-based project, really looking at population, habitat selection, movement, reproduction, and baseline information on some of our elk population. But there will be a small elk component in the elk project where we are looking at causes of mortality. We'll be doing some field necropsy, limited sample collection from these elk, trying to get some information on health as well. This project was supposed to start last year, but unfortunately the helicopter company that we were working with to do the capture work was delayed, and it got too late for us to safely capture elk. So this year we're actually going to be using walk-in corral traps in order to capture those animals, with the hope it gives us a little more flexibility. But we can still have helicopter captures as sort of a backup contracted method available. That project is going to be 2 years of capture work, looking to capture that 25 female cows, 15 males, and roughly 25 neonates each year for 2 years. Color those animals and then finally we have a big moose project that's coming up, starting this winter for northeast Minnesota. We have lots and lots of moose data. We've done a lot of moose research. So we have lots of data in adult older moose, and we have lots of data in neonate moose till they're about 6 years old or 6 months old. But we've got a little bit of a gap in that juvenile 6 months old to about 2 years old. And that's a pretty critical time point for recruiting into the population when they start reproducing and things along those lines. So this study is going to fill in that gap for us. So that'll be looking at capturing and collaring moose calves, so roughly 6 to 8 month old calves, following them, taking a look at recruitment, taking a look at survival, when are they fully recruited into the population, age of first reproduction. And then we're also going to do a much bigger health component within that project. So we're going to team up with Dr. Munchman and VDL. Whenever possible, if we have moose that die, we're going to try and get whole carcasses out for pathologist necropsy. As you can imagine, getting a loose carcass out of the middle of nowhere is not the easiest endeavor. So for those we can't get out, we will be doing some pretty detailed in-depth field necropsies to sample those moose and try and get some good health information and really good data on causes of mortality for that cohort of moose. This is a collaborative project, a big collaborative project. So we're working with 1854 Treaty Authority, Grand Portage, University of Minnesota Duluth, and really looking at that co-stewardship approach to moose management across their range. And so hopefully this provides a lot of information for us moving forward. So that's the extent of the research projects. One thing I thought I would just throw on the radar that we've been talking about quite a lot in our wildlife health team with DNR is trying to find better ways to improve some of our surveillance and wildlife. Our resources often get really heavily focused towards chronic wasting disease. It tends to take up a lot of time, but we want to do our due diligence to do monitoring across all of our terrestrial wildlife species in our program. So we are hoping to be able to expand some of that work moving forward. We have some internal reporting systems that we use now for cataloging any reports of sick or dead wildlife that get entered in. We try whenever possible to respond to some of those, get carcasses in for diagnostics and testing, but it's challenging to do so, and we don't have a good robust database. So we're in the process of developing a fish and wildlife health reporting system that we hope will allow for more information coming in as far as where people are seeing sick or dead wildlife, and then a lot better data management where we can integrate multiple sources of health data that we're seeing in our wildlife. So hopefully we can actually learn a lot more from this data. And then looking at more strategic approaches to how we design the surveillance and case selection. We can't do diagnostics on every sick or dead wildlife in the state, so how do we select our cases so that we are doing our due diligence, so that we are hopefully getting some good information and a snapshot of what we're seeing in our wildlife. And we really hope that this will help enhance some of our collaborative work with the board, with the Department of Health, really looking at more holistically health across the state of Minnesota when it comes to humans, animals, domestics, wildlife, across the board. So we hope that there's a lot more opportunity for information sharing and collaboration on approaches to how we go forward on our wildlife disease surveillance. So that's going to take a long time, I would imagine. So nothing's going to happen overnight, but that is an area of growth where we're really talking about helping our program to expand a lot more on that broader line. Okay, that is all that I have for you. I don't know if there's any questions.
You have a question?
Yeah.
Going back to the CWD, I noticed a lot of things, a lot of our incidents are bordering in other states. And are they doing as much work as we are in Minnesota? Can we get information from them? Like if it starts to crawl along the border there in Iowa, we can anticipate that we might have more, not just in southeast Minnesota, but Iowa.
Yeah, so, obviously every state's different in their approach and capacity. So I think there's a lot of variation in what occurs out there, and so we do have a Midwestern wildlife health group. So we do share a lot of information across states. But, intensity of sampling in some areas is just not going to be quite to the extent probably of what we have. And so there are just some limitations. Like I know we're seeing a lot of these cases pop up along the North Dakota border, and I don't know that they have a whole lot of surveillance and sampling going on in those areas there. We try whenever possible to utilize information of known positives in other states that are near our border to help inform us on where we should be doing surveillance. So we do communicate quite a bit, but there's a lot of variation in how much sampling different states are doing.
One more thing. Recently, in the last 6 months or so, I've had different people come up to me and talk about raccoons that are off, and I just say, well, it's raccoons ever. You guys track any of that or?
Yeah, so right now, we're in the process of trying to develop a little bit more streamlined processes and workflows We would still like to be able to monitor cases of raccoon distemper. We don't want to test every single one, once we've kind of identified it, we're probably good, but we do want to make sure we're looking at those neurologic raccoons because we don't want to miss raccoon rabies showing up. And so we've been having some discussions on how to approach case selection, and that's actually one that we're working on right now. In rabies suspects, and then how do you fill in those raccoon distemper suspects while still doing some monitoring. So it is on our radar. It is something, when we're able to get our hands on something to submit, we do want to do, at least to be able to confirm in a given outbreak. We are sometimes reliant on what is either reported to us or where somebody has the capacity to go get a raccoon to submit for us. But that's something we've been talking quite a bit about because we don't want to miss raccoon rabies.
Maybe missed an opportunity to get a writing. But even for reporting, it's some of, see all this is secondhand to me.
Yeah.
So I first I see ratings, but then I have to calm everybody down and say, can we do student?
Right.
We don't know, just stay away from it.
Right. Yeah, it's challenging and it's challenging for us. We're always trying to work through. We are so reliant on what our field personnel and managers have the capacity to go and do. And it's not always on top of somebody's list to go pick up a neurologic raccoon for us. So even when reported, we can't necessarily always get that case in. But at a bare minimum, we are trying to at least make sure we get the report. So that if we're seeing a lot of those reports, we can push a little harder, be like, hey, let's get some in here for testing. So, you can always report it to our area offices and we hope it gets into our reporting tool. And therefore, we do pay attention on a weekly basis, looking at what reports are coming in.
Okay, couple questions.
Okay.
So I guess first and foremost, thanks for your update, because I don't think we've had an update from the DNR for a couple of years. So there might even be some board members that haven't ever heard of DNR before. Excuse me. So thank you for that. When we used to get updates, there used to be some talk of doing special hunts in for white-tailed deer in certain parts of the state. So when you look at that increasing CWD prevalence, is that something that you guys are still doing? Are those special hunts to try and manage the deer population?
Yeah, and I'll be honest, I'm still learning here, so bear with me. I don't have all the details, but certainly looking at different types of harvest strategies for the hunt. So we were doing a late season December hunt that we have utilized to help manage in areas. So that's still a tool in our toolbox. And that's still on the table. We've also been talking, about other approaches to increasing harvest in various areas. And then, of course, we've been doing also targeted culling in a lot of areas where we have CWD as well. So we try and have a number of tools in the toolbox and be able to utilize them as needed. As far as other special hunts outside of that late season hunt, I have to go ask some folks about that. But I do know we've been using that December hunt as a disease management hunt.
Great. And then my other question for you is, with the wild turkey population research project that you're doing, one of the things that you tested for was avian metapneumovirus. And so as a producer who's been greatly impacted by that, I want to ask you, is there any other, waterfowl or wildlife species that you guys are planning on or discussing to test for that and look into that disease?
Yeah, that's a good question. No, there's not anything else that we're working on in testing. And I know my knowledge on avian metapneumovirus is pretty limited, but I always thought waterfowl were maybe more thought to be, a significant component. That's not something we have gone and done so far to date, but it is something we can put on our radar. And think about that. I think Dr. Voss was kind enough to put that on our radar as a pretty significant concern for domestic turkeys, which is why we started testing for it. So we'll have to see whether there are opportunities to expand that.
Any other questions?
The fast testing, have you already done work in aquaculture then, or not aquaculture, aquatics, like fish, maybe even like birds, since you're seeing so much in the water population?
Yeah, and we're gonna get into my realm of not a lot of knowledge, although I am working with our fish health folks, but, so they have done quite a lot of PFAS work in fisheries and in aquatics. Now, I don't think we have gone down the road of beaver, but we've talked quite a bit about how do you do a full trophic cascade, research evaluation of PFAS to see how that's working. So on our radar, you know, our aquatic folks are doing a lot of fish work, but I don't know a lot of detail on it.
For your update, I appreciate your time.
Yeah, thank you guys.
Ready? Okay, Shauna, when did you send your slides over there?
Like yesterday. That's the neutral for me, because I really only can't afford seven. I'm gonna cover a little bit of high-path avian influenza, although Stephan and Brian, they're on still with under, so that's, should be just a review. I will touch on pneumovirus, and I just want to give an NPIP update today. So this is where our case count stands for our high-path avian influenza outbreak since the start of the outbreak back in 2022. So we're on year 4. These numbers probably changed by, I think, one backyard. That's updated you in the spring. We're on 9.1 million birds. As Brian mentioned, we were able to declare freedom from high path on March 28th, 2025, and that was after our last commercial flock detection. Once their quarantine was released, then we reached that freedom days. But our last quarantine was closed on August 21st. That was our backyard flock. And so once that closed out, we have no more quarantines in place. We've got no more active control areas. Our event, and this is the term from our sit rep that we work with USDA. That's kind of our situation report that they use for their trading partners. We're now final closing result. So that was a really, you know, that was a really nice status to get to. And as much as that felt good, you know, we're not out of the woods and we're seeing what's happening in our neighboring states, and so that is concerning. This was the official confirmed cases for commercial flocks in the last 30 days, but we know that that number is higher with some presumptive positives that haven't yet. So I'm keeping pretty close tabs on what's happening in the Dakotas because it's pretty worrisome. I did look back on where we were sitting in 2024 and 23 with our fall outbreaks from when South Dakota had their detections to when Minnesota had, and it, you know, our fall detection, and it's usually been within a couple of days. And so when I started to see the cases pop up, I got nervous. We're now a couple weeks into this. So I don't know, time will tell. I would love it if we don't have a case this fall, but I don't know if I, you know, intend to do next time. To give you a quick update on avian pneumovirus, I know we've been talking about this now for over a year and a half since the first hit. So it continues to circulate, and it continues to be problematic, especially in our turkey industry. Chickens in general seem to be pretty, I won't say resistant to it. They're getting infected with the fact that it's significantly less. Most turkey flocks right now are currently being vaccinated. And so that's a change from when we last talked. The vaccination strategy started in the hatcheries just because of the limited availability. But now those vaccines are also available to be used on farm. Like I said, the disease is still present, it's still causing illness, but those significant impacts are down. The vaccination is new to our poultry veterinarians. Right, so these are vaccines that we're able to import in from Europe. We do have some vaccines that are autogenous vaccines that are created through US companies here. But how they work and how they're being utilized and what the impacts are there's still a lot of questions there. And so our vets are trying to figure out with the cases that we're still continuing to see, is it, we're seeing less this summer? Is that because of just the normal seasonal variation of this virus? Or is the vaccine actually kind of pushing down those impacts? They are concerned because we are using some modified live vaccines that there potentially could be what they're calling a Wheeling reaction, right? So we're infecting birds because of the vaccine itself. With our goal of trying to protect them, we might actually be spreading it. What they have seen is that the vaccine, they're seeing some infections in younger flocks than they were seeing prior to vaccine usage. So there's just a lot to learn about how this vaccine is working. I'm really glad that we have these vaccines available and the industry is utilizing them, and hopefully just over time, we kind of figure out how to incorporate them and what those impacts mean. We continue to test a lot of flocks with pneumovirus for high path as just a precaution. Just because we're still seeing some spikes in mortality with some of these flocks, and knock on wood, AI test comes back negative and then they come back positive for pneumovirus. But we still just need to keep our guard up and be looking for it and testing for it, just so we don't mess like that amongst all of this. This is just kind of a tally of the vaccines that are available, and it's pretty numerous, and I have to keep a little post-it note on the front of my notebook to reference which ones are live vaccines, which ones are killed vaccines, what the different companies are, and what the different serotypes are that each of those vaccines are made up of. So I think a lot of the vaccine usage at the hatchery but at the farm is the Sawatzke, which is the type A. Everything else is primarily type B. And so that's another piece of that learning, is we primarily have A in Minnesota, but we do have some B. And so when we use a vaccine that's developed off of B, what does that mean, right? And how does that impact things? So again, there's lots of tools out there, which is great, and I'm really appreciative of that. We just need to kind of figure out how to wrap our arms around all these things. And lastly, I just wanted to get an update on our National Poultry Improvement Plan. We, every 2 years, we have an official state agency meeting, and they move it around the country. And this past summer, the official state agency meeting was host. That was in July. It's a 2-day meeting followed by a general conference committee meeting on the 3rd day. Dr. Savannah Busby is currently an acting or interim senior coordinator. I have it down to both because I'm not sure if he's acting or interim. Dr. Elena Sankey was put on leave this spring, and we haven't received any updates on if she's coming back or when she's coming back or anything. So I know Savannah is normally the what is her normal job? Compartmentalization coordinator. She's been asked to fill in, so it's a big burden on her plate to be trying to manage both of these. I want to give her a big shout out. They're doing as good a job as she's done, trying to manage a same meeting on top of all the other responsibilities and uncertainty. As I think Brian mentioned, the General Conference Committee of the NPIP does operate under a charter, and that charter was set to expire, did expire on May 11th of this year. And there was some uncertainty on if USDA would renew that. And we did finally get confirmation that the Secretary of Ag was going to sign it, and the charter went back into effect on May 30th. So there was like a 2-week window where technically the GCC wasn't a real thing. And that kind of left the NPIP staff in limbo for what they can and can't do and who they could communicate with. So I'm really grateful that that was able to be signed. I think it's a 2-year charter. That sounds right, Stephan. So it'll go until the end of May 20th. So because the charter was signed, we were able to have our GCC meeting. I think one of the big things that came out of both the biennial and the GCC, the OSA meeting and the GCC meeting
On the off years, we do a biennial conference. So last summer, 2024, we had a biennial conference, and then back in 2022, we had another biennial conference. And at those meetings, we are looking at proposed changes to our program standards and to the code of federal regulations. So all of the rules that we operate under at those biennial conference, we can come together, propose changes, vote on them, and then they go through that official rulemaking process in order to become official. We are still waiting on those proposed changes from back in the 2022 biennial to come into effect. So we're always like multiple years behind, behind and trying to figure out what rules and statutes we're following. And I think the 2022 rule changes are nearing finalization from what they reported to us. And so I hope that they can get that cleared up pretty quickly. As far as updates at the MPIP meeting, we had 33 states present at the meeting, which I thought was a pretty good turnout for that. Just some significant reports that other states were discussing. It's not just Minnesota. Lots of other states are seeing increases in detections of mycoplasmas, so both MS and MG. And so has had kind of a run of that last couple of years. And then the cause of this increase is not known. We're all kind of suspending that virus, which suppresses the immune system, might be having a role in this, or maybe it's all in wild turkeys, so it's spreading it to us. But we kind of talked about, between states, how to work on better control for plasma, how to make sure that we're not just living with it, we're actually trying to eradicate it and not have those infections continue. We had some discussions about state import requirements, so each state is allowed to develop their own requirements for importation, and that might be testing or permitting or whatever certificates, right, each state wants to use. And so it was a good opportunity for us to kind of talk together about how we can try to work together to make sure that, Minnesota's not shipping something down to Florida that then violates their import requirements. And then, of course, we always have to talk about influenza because poultry sensitive. There were 4 interim proposed changes that were put up for consideration at the GCC meeting. And I just want to point out, put them all up here, but I also want to point out proposal number 1 that was considered, and what that was going to do is that it would add an H5, H7 avian influenza vaccination monitoring program. So within the NPIP, there's a lot of different disease surveillance type programs. There are avian influenza monitored and avian influenza clean program for breeders and commercial flocks. But this would then add a vaccination. And what the intention was, it was kind of a placeholder. It would allow producers to vaccinate for influenza. The problem was that there's no specifics on vaccines to be allowed, because we don't know what sort of surveillance would be required, because again, we don't know what type of vaccines are being used. So there was too many questions, and there was concern that this was kind of lessening the integrity of the NPIP program, or just having this great program included. So they ultimately decided to just table it. We didn't fail it. We still think that it's maybe a valuable program to be added at some time. So this will probably come back up for consideration at the biennial conference, which will be in 2026. Otherwise, proposal 2 was modifying some of the language within the CFR related to the general conference committee. And they were specifically trying to get it to align with an executive order form that it's the DEI ones, to remove some of that language as far as what's required. And they again decided that that's going to go through the normal administration processes. And we don't need to have a proposed change on it. So they pulled that up for consideration. Proposal 3 just corrected some typographical errors that were within the program standards. And then proposal number 4 modified the language for the compartmentalization program. So that's a program that mostly primary breeders are using to prove to our trading partners that they have a department that reduces the risk of that inflammation, infected with influenza. And so it allows them to continue to trade with other countries, even if we had influenza detected in the country and the state. And part of that program involves auditors. And the way the program is currently written, it's a pretty intense training program to become an auditor. And because of the different resignations and some of the buyout options, the USDA has lost access to some of these auditors. And so they recommended adding some language that if you were a previous federal auditor, you could continue to participate in this program and be an auditor. And that one did pass. And so they were just facing up shortage of auditors to be able to maintain that program. So this was probably mandated that they'll probably need some additional consideration. But hopefully this gets in the next way. That's what I have for updates. Happy to answer any questions.
Any questions for Shauna? Thank you. Okay. AJ, can you hear us?
Yes, I can hear you. Can you hear me?
I can hear you. We
Okay.
are.
Am I coming through all right?
Yes.
Okay. If you guys are ready for my presentation, I can go ahead and share my screen.
Yep.
Okay. I have not shared on Microsoft Teams a presentation before, so excuse me if this is taking me a moment. Are you seeing my presentation screen now?
We are.
Okay. And you're seeing it not in presenter mode, but in the mode that you should be seeing?
I think so, yeah. Yeah.
Okay, awesome. Get my little laser pointer. So first of all, thank you all so much for inviting me to come and talk to you guys. I'm happy to be able to talk about our work that we've done on dairy farms and appreciate the opportunity. It's kind of funny because I've been a molecular virologist for a long time, working in flu and especially in now Simo Lakdawala's lab, where we really focus on influenza transmission. But my degree is actually in plant pathology, so it was a lot of agriculture just on the crop side of things before this. So I've kind of loved the opportunity to get back to some agricultural settings with this work. And just first of all, before I jump in, I want to acknowledge everybody who has really helped out with this project. It's been a massive effort that could not have taken place without everybody that's listed here and the different organizations, from especially the farmers and dairy workers to the California CDFA, veterinary clinics, and then representatives from the dairy industry as well, the Milk Producers Council and the Dairy Research Foundation. And for any of you guys, if you all want to jump in for questions at any time, please feel free to interrupt me. I'll try to leave about 10 minutes for questions, but again, like if you have a question, jump in anytime. All right, so I'll just kind of get into it. I think everyone's well aware that there was this outbreak of highly pathogenic H5 avian influenza in dairy cows. That was first reported in Texas and in Kansas in March of 2024. And initially, spread of this virus throughout the United States was facilitated by the movement of infected cattle. And these cattle were kind of had characteristic clinical signs such as abnormal milk, mastitis-like milk, with very high viral loads in the milk itself, sometimes even rivaling like what we're able to culture in a lab. But how transmission from cow to cow and from cows to other animals on the same premise continues to be investigated and is still kind of under investigation now. But this high concentration of virus in the milk really led our group to focus on the milking parlor as a hub for transmission, since that is the space in which people and animals have the highest contact with milk. And so we really focused in our work on 5 different potential routes for transmission that all kind of originate in the milking parlor. And I'll go into a little more detail on this. So our first one, really the parlor workers themselves, they're exposed to milk and milk-based aerosols with little PPE at times. And I think there's been 41 cases of parlor workers being infected with H5 to support this. Also, the disposal of contaminated milk into the wastewater stream, so the on-dairy wastewater stream, and instances where that wastewater could be accessed by wildlife around the farm and by other dairy cows. So in the milking parlor, cows are in close quarters. So if there is a respiratory element to the transmission of this virus, potentially that could be at play here and other areas. But also for cows, the potential inhalation of milk-based aerosols. So throughout the milking process, there could be this generation of large droplets through things like force stripping, letdown, when the milking units automatically disengage from the teats. That can generate these aerosols that potentially could contaminate surfaces, but also may be inhaled. And then there's the milking equipment itself, which has been what a lot of people have focused in on because it's shared between large numbers of cows and without sterilization in between. And we know that the mammary glands of cows can be infected with this virus at a very low dose or very low concentration can lead to productive infection in the mammary gland. So our question really was, how is H5N1 spreading within a herd? And we're investigating these different routes, which I've mentioned, the milking equipment, milk-based aerosols, the potential for respiratory transmission, as well as contaminated wastewater on the dairy. And to give a brief background of the dairies themselves that we sampled, we worked on 14 different dairies in 4 counties. And as you can kind of see on the map, they kind of span the region of California's Central Valley and a little bit below the valley around LA County area. But we had dairies of varying sizes. So something like a small to medium dairy for California anyway, with about 500 cows in milk, all the way up to, for what in California is a very large dairy at over 3,300 cows in milk. A couple different housing pen styles, multiple different strategies for how these dairies were moving their wastewater around and utilizing their wastewater, along with a few different styles of milking parlor. And 7 of our dairies had active H5N1 infections with cows with clinical signs present at the time, sick pens going on, and then 7 of our dairies, they had H5N1 infections at the past. But the status was unknown at the time of our sampling. So whether or not there were lingering clinical cases or cows that had not returned to full milk production, we weren't able to sample the bulk tank on some of the dairies. So all of the dairies had H5, but there were 7 that we didn't know the exact status of the outbreak at the time of our sampling. And the types of sampling that we did to kind of answer our questions, we did surface swabs of the milking equipment, we did air sampling, we did wastewater sampling, and then we did a longitudinal study looking at H5 infection in individual quarters of cows over time. And this was really to kind of tease apart whether cows might be getting infected via a systemic route or whether it might be more of a mechanical based transmission to individual mammary quarters, for instance, through the milking equipment. So to get right into the results, we were able to detect the virus on milking equipment like pretty frequently with high efficiency. So we sampled both the liners that are in contact with the cow's teats, and we sampled the shells that the parlor workers would hold to place the units onto the animals. We ran qPCR analyses on these samples, and the results of that I'm showing you here. So for both the liners and the shells, we were able to detect virus pretty robustly. So 40 is our limit of detection, meaning very low concentrations of virus at a CT value of 40. And then the lower the CT value, the more concentrated the virus is in that sample. And on these samples, on a few of these samples, we were able to detect infectious virus as well, which I'm showing on the graph on the right here. So just showing that these surfaces are contaminated with virus after being used by cows, and potentially that could serve as a mode of transmission. So I'll go a little bit into the air sampling because we really focused on this in our efforts. We really wanted to know if we would find virus in the air, in the parlor, and across lots of different environment types. Since I think we all think of flu as a respiratory virus, we really wanted to see, okay, is this happening on a dairy? And so we used these 3 different samplers that are all a little bit different. So the PTFE open-faced filter is a small portable air sampler. It has a pretty low flow rate of 5 liters of air per minute. This is very close to a human tidal breathing to get an idea. And PTFE is the matrix that the aerosols are captured on. So it's this white filter in here. And it's highly adaptable. So most of the time we wore this on a backpack with the little filter like right at shoulder level to kind of mimic workplace exposure. Our middle range sampler was the MD8 Airport, also handheld. It has a higher flow rate of 50 liters per minute. Sometimes we used it, or almost always we used it with a cone, as you see here, which just helps to really focus in on the aerosols that we're trying to collect. And it collects onto a gelatin filter, which is designed to preserve the viability of any pathogens that you might be trying to collect on the filter. And then we have the AirPrep Cub, and that's our high flow rate sampler. It's designed to be used in larger spaces. It has an airflow rate of 200 liters per minute, and the aerosols are collected via like a wet foam method that uses electrical charge. And I'm going to show you soon a lot of negative air samples. And the reason for all that is that successful air sampling for pathogens of really any type, but viruses definitely, can be very challenging. So when you're sampling for virus in the air in all these different locations, you're dealing with dilution of your targeted aerosols into the surrounding air. And that's really what I'm showing in the pictures here, is that you can see we've sort of picked out these areas that we think are producing aerosols. And in some cases, we know they're producing aerosols, but you can also see that dilution of these aerosols is kind of unlimited because we're just in the open air. The matrix that we use for collection can also be a limiting factor. So depending on the pathogen, even different virus strains, some matrices are going to be better for others for capture. And then the air samplers themselves collect different size aerosols with differing efficiencies. So depending on the size of aerosols you're intending to capture, it might change which sampler is the most efficient for you. And that's kind of a trial and error thing a lot of times. Also the flow rate of the air sampler. And all of this is to say that an inability to detect virus doesn't always mean it's not there. It might just mean that you aren't capturing it because it's quite a challenging thing to do. So all of the samples in the pictures I'm showing you here were all negative. When we took these samplers into the parlor environment, which is a little better because it's not open to the environment as much as just being outside, we got a couple positives. So wearing this on a backpack, sometimes up to 3 hours at a time when we'd be sampling in the parlor, kind of going with the parlor worker throughout their milking session. We got a couple positives in that scenario, but out of a big total, so a lot of negatives. The air prep cub, which was our larger air sampler, we didn't get any positives from this, so all 15 samples that we took were negative. We put this in spaces with a lot of clinical cows, so definitely with active outbreaks, many affected animals, but didn't get anything from this guy. So our sampler of choice ended up being the MD8 airport that has the medium flow rate. And at least in terms of the parlor and the breath of cow samples, we got 32 positives out of 70 total samples. And these were taken following the milking process, as you can see in the photo. I just kind of followed the parlor workers as they went down the line throughout all parts of the milking process. And then also when cows were in headlocks or in stanchions, I kind of took the sampler in front of them, held it in front of the animal, and allowed them to breathe into the sampler for several seconds and on down the row for about 15 to 30 cows. And so what I'm showing you here is our qPCR results first. That is the graph on the left. And so really what you can see here is that in the parlor, which are the circle samples, we were able to detect virus in the air on multiple different dairies on multiple days. So this is pretty robust detection and pretty robust results to say that there is virus in milking parlor air. These triangles are samples from the breath of cows. So you'll see here they're all right near our limit of detection. So very low virus concentration might be expected because we don't expect a lot of virus, obtained via that method, but robust enough to say that potentially there is some virus being exhaled by these animals that we can pick up. And then on the right over here, we were able to recover infectious virus from some of our air samples as well. So just showing that aerosolization in milk and in the parlor does not immediately inactivate the virus. So potentially in these spaces, there's virus in the air and infectious virus in the air. And I'll just mention again that because of the difficulty of air sampling, these are likely to be underestimates of what could be in that environment. And then I'll move on to our wastewater sampling. So this was really facilitated a lot with a lab, the Wolf Lab at the Emory campus, who does a lot of wastewater sampling. They started sampling to look for COVID and then came to us to help us to look for influenza in this wastewater environment. So on dairy farms, wastewater is open to the environment at several different points and can be accessed by peridomestic wildlife and by wild birds. The manure lagoons themselves often have a neutral pH that does not inactivate the virus just on contact. So we thought initially, okay, maybe if there's a lot of manure and urine potentially going into these lagoons, maybe the pH will be low. But we didn't find that to be the case, and that's been published not to be the case before. So potentially there's nothing that would just automatically inactivate virus that gets flushed into a lagoon. And then that lagoon water itself can be used in a variety of ways on a dairy farm, from going to crop fields or pastures, as you see in the diagram here, to being used to flush out different freestall barns and things like that on the dairy, whether or not it's mixed with some fresh water as well. But really what we're worried about is this idea of very high concentration milk coming from sick cows, not having any sort of inactivation process in between, and then flowing into manure lagoons, crop fields, and potentially being accessed by multiple species along the way or at this destination. So for our sampling efforts, we focused on 4 different locations along the wastewater stream. So the first one is the milk line cleanout. And at least on the dairies that we visited, if the sick cows are not getting milked into these sort of dump buckets where they just separate out the cows and then dump the milk straight to waste. If there's a lot of sick animals, we saw that for many of the larger dairies, they'll milk their sick pen just last in line, and then that milk is going to be what is left in the milk lines just prior to clean out. So when the milk lines are flushed before the clean in place system is hooked up to clean the actual system in between runs, it's this potentially high concentration virus milk that could be flowing through the waste stream. So from the milk line clean out to the sump pump, we sampled from the sump pump, the wastewater is pushed out to the manure lagoon or to pasture, and sometimes from the manure lagoon out to a pasture. There can be mixes with well water at any of these stages. So we sampled in these 4 locations. And the takeaway here is that we were able to detect virus in all the locations that we sampled. We got infectious virus from 2 of our samples. And again, this was also pretty lucky just in terms of storage conditions of these samples before we could process them. But one of the takeaways is that across all locations, we saw samples that had high virus concentration and samples that had low virus concentration. But in every one of the locations, you could get both. So this definitely, as you can see in the little video that I showed, sometimes you can have these sources of potentially contaminated milk kind of running through a lot of different area and open to the environment where things like small birds can access it. And I think we all have heard about, the die-off of cats on dairy farms as well that have drank contaminated milk. So we wanted to look at pH-based solutions that could be used to inactivate sick milk. I know other groups have looked at this as well. I think especially the folks at UC Davis have shown a similar thing where low pH solution can inactivate virus in milk from cows. But we just did some assay in our lab where we spiked virus into raw milk. And then we chose a couple acids that are easily available or commonly available and easy to use. So we started with lemon juice and vinegar. We incubated our virus spiked raw milk with these acids for up to an hour. And essentially, we were able to show that using 3% vinegar in our treatment scheme was an efficient way to inactivate virus after 20 minutes and complete inactivation after 1 hour. So depending on the dairy, something like this may or may not actually be feasible, but our lab and other groups as well have shown that potentially treating milk with a low pH solution could be used to inactivate some of the sick milk prior to disposal. And then I'll move on to our longitudinal study, which we wanted to examine H5 positivity in individual quarters of cows over time. And so this kind of stemmed from the observation that mastitis-like milk was one of the primary clinical signs associated with H5 infection in cows. And also these controlled infection studies showing that H5 infection didn't spread among quarters. And so with mastitis, contagious mastitis, it's known that can be spread through milking equipment. And so potentially you might get a quarter that, or 1 or 2 quarters that predominate in cases of mastitis. So on one single farm, we looked at cows that had mastitis, we looked at cows that didn't have mastitis, and we thought, okay, it was an active outbreak farm. Do the cows that have mastitis also have H5? And we were able to show here that cows that were in treatment for mastitis were more likely to have H5, but not all of the cows did. So there wasn't a 1-to-1 correlation between the sign of mastitis and H5 infection, just meaning that potentially a lot of cows were subclinical. And this was one of the farms where milk drop did occur, but other than a slight drop in milk, there were not extreme signs. So a mastitis on this farm was being used as a diagnostic sign of H5. And so this is kind of a snapshot of mastitis cases on a single day on this farm. We just kind of asked the parlor workers when cows were identified with mastitis, what quarter they had it in. On this particular day, there were 6 cows that had it in the front right quarter and very few cows that had it in other quarters. And there was only one cow that had it in multiple quarters, and that was one that had the front right and back right both. And this is important since milking units have orientation, and the same teat cup is placed on the same quarter for every cow. So we thought if milking equipment is involved in the spread of H5, maybe we could see a pattern where there's a predominant infection of a particular quarter with H5, similar to what might be seen in mastitis cases. So we got our group of 12 cows and we sampled each quarter of these cows for 7 days. But we did not see the same thing for H5 like what we saw with mastitis. So what I'm showing you here is H5 infection by quarter. So in our 12 cows, the distribution of what quarter had H5 was pretty uniform among all the cows. And if anything, the front right quarter had fewer cases. And that, I should mention that the cows had different numbers of quarters infected. So it wasn't necessarily that every cow had all 4 quarters infected. Of our 12 cows, there were 5 that had only 1 quarter infected. There were 2 cows that had either 2 or 4 quarters infected, and 3 cows that had 3 of their quarters infected. And we did see that the infection didn't spread between the quarters over time. So the quarters that we observed to be infected on day 1 were, for the most part, the same quarters that were infected on day 7. So we didn't really get the kind of very strong conclusive information from this like we hoped to show that, okay, milking equipment is definitely involved in the transmission here. And nor did we see anything that might indicate, okay, these cows are getting infected by a systemic route and every quarter is infected. So really what we were able to conclude and what we can conclude from our work is that on an affected farm, the virus can be everywhere. And a lot of this is dependent on how dairies are managing different strategies, especially wastewater and waste milk. But our results really support the focus of any risk mitigation strategies to circle or center around the milk and the milking parlor, and this idea of the milking parlor as a hub for onward transmission. Since we do see virus in the air in the milking parlor, we see virus on the milking equipment, and then the wastewater itself can be a conduit for carrying infectious virus and potentially being accessed by peri-domestic wildlife, but also depending on how it's used to further contaminate the dairy itself if it is used to flush out freestall barns or something like this. And potentially what we're seeing here is there might be multiple modes of transmission at play on these farms. And it could be that potentially each mode of transmission is inefficient. But if there's no control in place to stop the modes of transmission with, thousands of cows on a farm and these cows are milked twice daily, you might have just enough to push transmission forward on a farm and to other animals. On the other hand, it's hard to implement risk mitigation strategies and risk control if you don't know how transmission is happening. So we're hoping our work goes to support that effort to find out how transmission is occurring. And I will conclude with that and ask if anyone has any questions. And also, please feel free to reach out to me by email if any questions come up later.
Are there any questions for AJ? Could you maybe clarify, is this project ongoing still? Are you still collecting information, or is there more to this project?
Yeah, it's a great question. So because there are not really further active infections, at least not in California, that we have access to, that part of our surveillance, looking for the virus itself, is over. However, we are really lucky to be able to go back to one of our farms that we had been on previously, and we're going to take samples of milk and samples of blood to look for antibodies and to get an idea of how long antibodies are present in the milk and blood for, if there's any difference between antibodies in milk, antibodies in blood, And then to figure out, to kind of get an idea of how long cows might be protected from reinfection, or if they will be protected from infection with a different strain.
Thank you for your, sharing all that information. It's very interesting. We appreciate your time.
Yeah, thank you guys so much. Let me.
You're ready for some thought?
All right, thank you, Aaron. Thanks for the opportunity to meet with you all. My name is Scott Wells. I'm a veterinarian and professor at the College of Medicine, University of Minnesota. And I want to talk to you just for very few minutes here. Certainly, I don't have the kind of information that she shared, but that's a good thing, right? Because Minnesota has not had such an outbreak. But to talk a little bit about some work that we have started, ongoing, what we plan, how we're changing it to fit the situation. So last summer, from APHIS, Dr. Schaefbauer and others say, hey, we've got some funding available. We need to figure out what's going on with this influenza, right? Good thing. The thing is, there's only one cooperative agreement for this research for states. You've got to coordinate this all. It's got to be supported by your state veterinarian, by the area veterinarian in charge, Dr. Schaefbauer. And so I pulled together a bunch of folks. But basically, it was to use these emergency funds that APHIS had to address some key research questions focusing on this virus in dairy cattle. And it would be a 12-month cooperative review, which is typical for APHIS. To do these projects. And from that, we put together 9 different projects, different leads, different people at the University of Minnesota. But a lot of these focusing on some key questions, like what AJ was talking about. We have to know how this is spreading, and we're going to control this. So how does the virus spread amongst cattle? Is it spread through direct contact or other shedding patterns? What about through milk? What about environmental survival? How do we inactivate the milk? Inactivating or issues revolving around the virus and colostrum, because colostrum is a very different matrix than milk itself. Looking at airborne transmission, looking at potential risk factors and co-infection for the things going on in these herds that may predispose cattle. And then a more basic science question looking at virus-host interactions. So those are how it spreads among cattle on an infected farm, and then some other projects about how is this spreading to farms. So you can see an obvious common denominator. A lot of these involve having infected farms, right? And so 6 of these depend at least in part on detection of the virus on infected farms. And then obviously voluntary collaboration with producers. And for example, many of these would involve collection of samples from dairy cattle after infection, similar to what AJ was talking about. We want to do this in a way that makes it as little disruption as possible to the producer. Certainly no cost. In some cases, we could provide funding to the producer where the individual results could be shared. And then the individual producer information will remain anonymous. All sounds good. We got the money from APHIS, and I think late February through our university, we got it in place in March. And of course, we've had no new positive cases, which is a really good thing. I agree, Brian, for sure. And yet not to learn, right? Not to learn from Minnesota, at least very much. So, APHIS has said, okay, be flexible. Think about other things you can do with this funding, right? So we've been thinking about that, talking to people, talking to herd vets, et cetera. You know, some of these key questions, what's the source of the virus? Kind of difficult to tell. We don't have new cases at this point. Obviously, there were 9 last year. One of those tested positive again this year. We have sort of looked at those initial case investigation reports. For example, I just have a little bit of a summary from that, from these 9 herds. I recognize these are not the only herds infected last year, right? Because these 9 all volunteered to test. And whatever the reason was. But from these 9, you know, none of these introduced cattle from another state. Only one of those introduced Minnesota cattle from outside of their system. Probably were other herds that did introduce cattle from another state, but not these 9. There were some of these that had beef cattle on the premises or adjacent. A couple of those had horses on the premises. A third of these, 3 out of 9, I guess, had poultry or waterfowl on premises or the adjacent property. You know, all of these had multiple farm workers. One of these had a worker that worked on another swine farm. A couple of them owned backyard birds. You know, but what we have here, of course, is we don't have any comparison. We don't know what the negative herds were to compare to these infected herds. And that's typically what we do with these observational studies. Wild birds, we know that, of course, most of these have wild birds in the area. Most of these small birds are pigeons and starlings, and a lot of these have rodents, of course. But we don't have any comparisons. Our thinking is, if we do get an outbreak, then we could potentially look at this. And then going through working with herd veterinarians, we could collect data from non-infected herds, be able to compare to this, look statistically for some big associations, if they're true, and be able to identify some factors that may relate to how these farms are getting affected. We've done this multiple times, including 10 years ago, they had a big turkey outbreak. It can be really helpful. It's not a definitive study, but it's a way to sort of to get closer to where the answers are. Another question is, how is it spreading within dairy herds? Again, we haven't had new herds to be able to evaluate, so we can't go anywhere here. But the last question, so which cattle were previously exposed and are they potentially resistant to infection? So this is interesting. AJ just mentioned that as well, using serologic testing to look for antibodies. You know, the previous evidence of at least exposure, if not infection, and what can we learn from that? That's a big question. Not a lot of work has been done to this point in cattle. Partly because the places that had a lot of cases have been so busy dealing with the infection, they haven't really thought about some of these other questions. But we did have the opportunity to look at a beef herd here 2-3 months ago. This actually technically is not part of our cooperative agreement because they just wanted to focus on dairy cattle. This is beef cattle. Not a lot of beef cattle have been tested, but this is a unique herd in the state. Beef herd, a very small herd, where they also had backyard poultry, about 150 birds, and they were twice infected with different strains of Lyme. First one was genotype B.3.2 back in May of 22. All those poultry were depopped. And then again in February of this year, we obviously repopped again a number of different species. And this time infected with D1.1, again depopulated. And so then the question came to the producer. He had leased a couple of bulls. He wanted to send the bulls home, and the owner of the bulls said, well, wait a minute, maybe you should test those bulls before I take them back to my farm, right? Smart thinking. Of course, back in 2022, we didn't think that cattle would be involved in this. Certainly we know more now. So that led to this whole idea where the producer wanted to test, Environmental Health wanted to test, APHIS wanted to test. And so we went out there, full PPE, and tested these 11 beef cows, bulls and yearlings. And what do we find? No positives, no PCR, no animal. Very interesting. I mean, they were housed in a different place of the farm, but they were close. And you would think that those poultry could have had access to those beef cattle. But anyway, no evidence for active or previous infection, at least in those beef cattle. Of course, we started thinking, what about dairy cattle? Is there an opportunity? Could we get access would one of these dairy producers that were previously infected allow us to collect samples? And one of these, of course, you know, these infected farms are anonymous to us. They don't tell us who you are, right? It's private. But if a producer knows us and we know a couple of these, we know we're infected. And so one of these we contacted and they agreed to let us come out and collect blood samples here just a few weeks ago. Again, we're trying to look for presence of antibodies to the virus. Now, this is a herd that was positive a year ago, all right, on quarantine last August. So it's been a long time, at least a year, with no clinical disease. Obviously, no surveillance again until this spring, but then they have been tested monthly and entirely negative. And we want to be able to look to see, could we find antibodies at this point in time? If we could, would there be some difference in the seroprevalence in cows based on those that had clinical signs of disease and those that didn't? Maybe by lactation group. And ultimately, could we actually go further and evaluate whether those antibodies are actually neutralizing to whichever strain? In other words, would they be protective against reinfection? Because that may be valuable to producers, right? If they knew not only did they have antibodies, but they'd be protected. So we went and collected blood samples, like I said, a few weeks ago from cows with and without a history of clinical signs during that outbreak. They were tested here at the VDL using this idexalysa, which is technically, I guess it's the swine antibody A test that they're sort of reusing for cattle. Seems to work fine. And what did we find? I mean, overall, 205 samples, about half of them are positive. There's another section that's suspect on top of it. So there's a lot of antibody, at least this one herd here in Minnesota. You can look at lactation numbers, 40% in the second lactation group, 52% in third, 49% lactation fourth. I mean, a lot of different lactations were positive. We didn't test heifers, that would have been interesting, but we weren't even sure we'd find it. We wanted to make sure we had animals that were there at the time, right, that had gone through this outbreak. And also, that's too far. We looked at about half of those, 104, that had history of clinical signs, and another 100 that did not have history of clinical signs. And those that had clinical signs, basically 2/3 of those were antibody positive. And those without any signs, 1/3 antibody positive. So you can see there does seem to be an association with clinical signs, although even if they didn't have signs, there's a lot of antibody. Obviously, this went off. So now the question is, yeah, we know there's a lot of antibodies out there, at least in one farm, but are they actually protective? So now we're going to meet, actually got a meeting tomorrow with some folks that are immunologists to go further. We're going to look, actually, it looks like it's going to be a partnership with South Dakota State. They've got a serum neutralization test. We've got some folks that have done this kind of work, working with swine and PRRS virus. So working together, we want to be able to evaluate this. I think this could be really of interest to producers to know. I mean, they know if they've had clinical signs, right? But they don't know if they're protected against this strain or which strains, and that may be fairly useful to them. So I'm going to stop here. Just a quick update on some of the projects we have going. Lots more. Certainly want to acknowledge the board for sure for the support, as well as APHIS for the funding. Diagnostic lab producers, some of our team. I think this slide here is the leads on all the different projects we have at the university. So not very much information, but it's going, and we want to be flexible, right? APHIS is telling us to be flexible, right, Stephan? So we can help. Any questions?
When you say Minnesota cattle producers, is that like Minnesota milk, beef producers, both?
Well, we've got one beef producer that's allowed us to sample, so there's one. We have one dairy producer, we're gonna get more, so we're gonna, it's an ongoing thing.
Sure. This is sorry, can you begin? Okay, so correct me if I'm wrong. The farm that tested positive this summer, the dairy farm, was that positive just coming from one cow And if that's right, what is she being used for now? I mean, is she like also being tested, or is there information that we can collect from that cow?
Yeah, I think Brian would have a little more. She's gone from that herd.
Right, right, not on the farm.
She's being researched.
Yeah.
I didn't follow up. Do you have anything more about that?
No, actually, I wish I could chat with Marie about it. She's the last contact I had. So the cow was donated, as I understand, to USDA, and we had an arrangement with Iowa to ship her down to Ames to do further research. They kept her for, was it 2 months? They kept her there, so they brought her back into milk. They got her lactating again, so they did collect samples, blood samples, and eventually they euthanized her after they had collected her samples. She was getting a little ornery too, I guess.
Oh, so she's not even in Minnesota.
She's no longer with us here, Minnesota or elsewhere. But I think a lot of that testing is, the results are still being gathered. I haven't seen what results came from that, but it's a question because it's a peculiar case. It's the only positive we had this year, and it was frustrating to us. It was frustrating to the producer. We convinced them to test individual cows, and this was a 250, 300 cow dairy, something like that. So a lot of cows to test individually.
Yeah.
But we were able to pool samples until we got down to one individual, and she was, it was a herd from last year, and the speculation is just kind of, for whatever reason, she harbored the virus. The other cows, negative. Or the PCR, I'm not saying ELISA testing on those, but, so I don't know, a lot of speculation. I would assume it indicates her immune system is functioning differently than most cattle on the farm anyway. So for whatever reason. But if you talk to Carol Cardo, she says food viruses don't like to hang around. So there's something peculiar about just the whole scenario. More to come.
That's very
It's in USDA hands.
That's a very strange case.
Is it an older cow, younger cow?
She was a multi, I think she was like, older cow. I think she was, so the farmer was intending to cull her anyway. She was a problem breeder. So that was another interesting thing that they couldn't get her bred back. So she was in an extended lactation already, and he intended to cull her anyway. So he was sad to see her go just for that reason. But that was another question that Marie with, is this affecting her reproductive capabilities? Is there some connection there that's why she was not settling? So,
But if it was sad that she had had it over a number of years.
right. Well, she would have been, she would at least would have had it earlier in the previous.
Yeah, I mean, but when they get tagged, difficult breeder. Very.
Yeah.
You give them a little leeway for like 2 or 3 times. And so that extends.
Yeah, I mean, the thing is, originally there was no individual tested a year ago, so nobody knows. There's just no long time was positive, right, in 2024. So a year later, well, 9 months later, when she was detected by surveillance in March or April.
Yeah, I think she was probably in like a 400 some day lactation. So not multiple years without having a cat, but then extended.
So this particular year, they were having trouble getting her back then.
Yes. Lots of questions. Obviously, cattle are not turkeys. And we need to learn a lot more, but we don't want to be more positives, right?
How long is your cooperative agreement pending last for? Like, are you in the beginning of the stages? So there's still a lot more information that you can.
Yes, but I mean, we're 6 months in. So the cooperative agreement, I think with APHIS technically is the end of February. Hopefully, if we don't have outbreaks, we'll be able to get no cost extension for a bit, but it's not going to go indefinitely. They want us to spend the money, obviously. There's a lot to learn, but it's a little challenging when you don't have a case that's right. But maybe there's some things we can learn from animals. Somebody else said,
So
yes.
just related to that, are you able to kind of collaborate across state lines with other jurisdictions that do have positive cases of Medina?
So yes, I mean, the cooperative agreement is for Minnesota, but there are other cooperative agreements too, and yeah, APHIS is supportive in general, all that sort of thing, as long as we can work together as states. for sure. So we've had this discussions, like I mentioned, with South Dakota, with Colorado State. So far, not with California, they're so busy, they don't have time to collaborate, I think, but, yeah, we've got some ideas, Stacy. There's possibilities.
And for like the retrospective studies, is there any concerns from the herds that, you know, either we as a group could help address, you know, privacy concerns or things along those lines that are making producers hesitant to participate?
So I'm making sure I understand. Yes, there's lots of privacy and confidential concerns for sure. Is there possibilities of alleviating that? Is that what you're getting at?
Yeah, just, you know. if
Trying to get more participation.
Yeah, like, is there anything that we can do just through our contact?
I mean, you know, they're herd veterinarians, I think, is a good possibility. They work with these herds. There's ways we can do things. But we can keep the information data confidential. That's what we've kind of proposed doing all along. You know, it really helps if we can do some testing, like serologic testing, which will trigger regulatory responses. Because it doesn't indicate live virus, it indicates something in the past. Yeah, all those things, we're thinking through. Obviously, we have to find projects that are, what's the right word, amenable to producers, that provide something that they're interested in. So I think this, looking at protective antibody is a good direction, because that's something that could indicate their future risk. Essentially, they could be reinfected and go through this loss again. Yeah, surveillance is happening separately, but it's not part of this. That's a whole separate pathway. I don't know where you're getting, at what you're talking about, or is it
Yeah.
something more specific?
I was just thinking, you know, like, for us, coming from the health side, there was lots of concerns about privacy and talking to, you know, workers. Whereas we have, you know, a long history of working with the poultry industry and building up the trust of being able to monitor people. And so I was, you know, our assumption was the same was happening in dairy. So just like trying to see if there's anything that, you know, we can do, because we are starting, you know, from ground zero, where we just need basic understanding of pathogenesis and what's happening so that we can help. In the, you know, any messaging that we can, you know, help.
Yeah. I don't know that it's a messaging, it's just working through trusted channels and things like that.
I don't think great segue, but I just want to thank the university for having that information, because you got part of it and we could get as regular. So it's an obvious partnership. It's a great partnership because you present the non-regulatory side and are able to get information for us, but also for our producers. So I think that's the key, being able to collaborate with a less threatening agency, I guess, and then getting relative information that we use in real times. Appreciate all the work you've done and that you're doing.
Yeah, we'll see what happens. Good, well, thank you.
Thank you. Okay. It looks like that's everything on our agenda as far as updates and presentations. So our next meeting is December 3rd. We will need a location for the recommendations, let me know. Otherwise, can I connect with you, please? Yeah, on that. But if anybody has recommendations, let me or here know for location. February, we'd like to set our February date. Anybody want to throw out, a date?
Six.
Yeah. Can we stay with Wednesday, everybody?
That's great.
Oh, so nothing. Or? So, yeah. That was very small. Yeah. The 8th is the 18th for the first time. That number? No. But probably we're going to these things will work. Okay, going one, going twice. Okay, February 4th. February 4th for the next. Six. Say what? You're. Okay. So at this time, we will not be adjourning because we do have closed special session that we will be going into. And it will take place in this room. So everybody in this room will need to leave. And I would suggest that you all go see our celebrity turkey that are hosting. Okay. Welcome back to the Board of Animal Health meeting. And we're now back from our closed session. It was found there were two respondents. The first respondent was found to be in good standing, and their registration is now in good standing. The second respondent, their registration will not be renewed as of January 2026. At this time, I'll ask for a motion to adjourn the meeting.
I make a motion to adjourn.
Is there a second?
Second.
It's been motioned and seconded. Any discussion? All in favor?
Aye.
All right, motion carries. Thank you all for coming.